from Global, leading Britain's conversation. Swarbrick on Sunday with Tom Swarbrick, live from Westminster.
Just gone 10. Very good morning to you. You're listening to Swarbrick on Sunday here on LBC. Hope we find you very well at the start of 2021. On the show this morning, are your children back at school tomorrow? If they are, should they be? The teaching unions have piled the pressure on the government this morning to close all schools for 2 weeks, with some now threatening legal action. We'll be joined by the Cabinet Minister Liz Truss and by Labour's Shadow Education Secretary Wes Streeting. Plus, the Oxford vaccine is available from tomorrow, but for whom and from where? Your vaccine questions answered from 12, and we're out of the EU. What should Britain do next? We'll hear from a former Brexit secretary on the programme.
Call 0345 6060 973. Tweet at LBC. Text 84850. Swarbrick on Sunday with Tom Swarbrick on LBC.
Very good morning to you and a very happy new year to you. If you have been managing to spend the last week or so blissfully ignoring the headlines, then let me bring you right back up to speed this Sunday morning. It's not great out there. That is about the long and the short of it, I'm afraid. The good news is that there is another vaccine due here from tomorrow, which should, we're told, massively expand the number of people able to receive a vaccine. That is obviously terrific if it happens. But aside from that, it is beginning to look a lot like March 2020 again, a feeling that the government is either choosing to or is not able to act with the speed required for the situation, particularly, of course, given the new variant. And the biggest concern has to be, whether people like it or not, that the NHS is protected to the point where it can still function effectively for everyone who needs it. This is, of course, particularly acute now in London and the South East, where there are reports this morning that their patients may be transferred hundreds of miles to other, freer hospitals. According to NHS England, there are now 5,861 COVID patients in London's hospitals. That is now almost 700 more than there were in April at the worst point. So, is the NHS being protected enough? What is the situation in hospitals really like? If you work in the NHS, please do tell us what it is that you are seeing. What are you having to do to manage the cases that are coming in? If you work in ICU in particular, you may feel that the NHS is actually being protected enough. And frankly, more curtailing of your freedom is not the answer. Where are the Nightingales, you might ask? Where is the military support here? 0345 6060 973 is the number. In a moment, we'll speak exclusively with the Chief Executive of the London Ambulance Service, which had its second busiest day ever on Boxing Day. We'll speak to Garrett Emmerson in just a moment. First, LBC's Westminster correspondent Ben Kentish joins me live. Ben, very good morning to you. Happy New Year to you. It's not great out there, is it?
Happy New Year, Tom. Well, not a particularly happy start to the year. It's not great at all. I think if you'd said back in April, when we were hearing daily about those hospitals being inundated with patients, struggling to cope, ventilators being taken up, a desperate race to get more of that sort of equipment, if you'd said then that in 7-8 months' time, things are going to be even worse, I don't think many people would have believed you, and yet that's where we are. More patients are now in hospital with COVID-19 than they were at the peak at the start of April, and the number is going up by the day, up by about 2,500, Tom, and we know that is going to continue. Why? Because cases are continuing to rise. The NHS is already struggling to cope. You said there are already plans being drawn up to send some patients hundreds of miles away to areas where currently there are fewer cases and fewer demands on hospitals. But I say currently because what the case data is showing is that cases are rising rapidly in all parts of the country. And what doctors and scientists and politicians fear, Tom, is that it's only a matter of time before those areas that are currently being used as a sort of overspill, as it were, become full too. What happens then doesn't really bear thinking about, and that is why there is such an effort going on to increase capacity. But it is a race against time, and the question is, can that happen fast enough to help all the patients that are going to need that help in hospital for treatment for COVID in the coming days and weeks?
Yeah. And to that extent then, one question that is asked of the government is, what is it waiting for before potentially imposing greater restrictions on people's lives, which I think the Prime Minister has already this morning hinted at in saying we could have to go further in the next few weeks?
Well, that is the key question. They will say, Tom, that they are. They will say more and more areas have gone into tier 4. You've now got just under 80% of the country in tier 4. So when people say, why haven't we got a national lockdown? They say, well, actually, 4/5 of the country are in under restrictions resembling a national lockdown. But of course, that's not 100%. And even then, even if the whole country was in tier 4, we've had scientists just this morning and for the last week or two saying tier 4 probably won't be enough and that more measures will be needed. That probably means, Tom, schools, universities closing, maybe even some workplaces. But when you look at the data, it does seem that is what is likely to come, at least with education, I think, despite the Prime Minister saying this morning again that schools are safe. The question is, when does it come? And will ministers once again risk being accused of acting slightly too late? But I would be surprised if there wasn't some more action forthcoming this week, Tom.
Good to speak to you as always. Ben Kentish, LBC's Westminster correspondent, joining us live on the programme this morning. Let's turn to Garrett Emmerson, who is the Chief Executive of the London Ambulance Service and joins me live. Thank you very much for joining the programme this morning, Mr Emmerson. Tell us what it's been like for your staff over the course of the last few days.
Well, as you said, I think earlier on, Tom, it's been incredibly busy. Boxing Day was our second busiest day. In fact, we've surpassed that now because New Year's Day was even busier than that. So we're busier than we've ever been, frankly, both in our 999 services and indeed 111. And my staff doing an incredible job, our staff and indeed volunteers out there every day, working probably harder than they've ever had to work before. And we are managing to cope. It's really tough, but we are managing to cope at the moment.
When we talk about busyness for London Ambulance Service, what do we mean? You're just having to answer more calls, you're having to go out to more blue light calls. What do we mean by busy?
Yeah, well, to give you some context, we're probably we're seeing double the number of calls we'd normally see at this time of year in 111. We're probably 50% busier than we'd be in the middle of a winter when we're normally at our busiest anyway. We're 50% busier again in 999 call answering, and more face-to-face incidents that our crews are having to go to than we've ever seen before.
So in those circumstances, you are nevertheless managing to cope. What is it that keeps you awake at night, Garrett, when it comes to the triggers that mean that you won't be able to cope?
I think it's sustaining this. The pressure that the organisation's under is obviously huge. What we really need is for the public to do their bit, and they are, in terms of responding to the Tier 4 restrictions and only calling 999 in an emergency and using online facilities and the wider healthcare system where they can to enable us to keep this going. Because as you've described, this is we're going to be under this kind of pressure for some weeks yet at the very minimum. So being able to sustain this over the long term.
I was going to ask, how much longer do you think you can sustain this at this rate?
Well, we've planned to be able to sustain this through the winter period. We always knew that the winter coinciding with a second COVID spike would be our biggest challenge. That's why we planned for it all over the summer. That's why we got more vehicles available, more volunteers, more partners working with us. We've had some tremendous support from our emergency service colleagues in the fire service and people like the AA supporting us to enable our trucks to roll out 24 hours a day. So working with our partners, working with our staff, working with our volunteers, making sure that we can see this through and we can be there for Londoners when they need us most.
You've got stories of people having to be treated in the back of ambulances whilst waiting to get into a hospital, such are the queues at the moment. On Boxing Day, I'm told you had nearly 8,000 calls. That's your second busiest day ever. There are huge concerns about the coming week. Do you think that you could see a busier day than Boxing Day over the course of the next 7 days?
Well, as I say, we've already had busier days than Boxing Day in terms of New Year's Day, and it's continuing to be at that sort of level of 7,500 to 8,000 calls every day. So it's the sustained pressure that I think is different. In the spring, we saw those kind of numbers, or just a little below those kind of numbers, but for a very short period. We know this time, because it's the winter rather than the spring, it's likely to be more sustained. So we're working with the whole health system in London, working with the hospitals, the acute sector, the primary care sector, to make sure that we've got as many pathways open to patients and ways of treating patients and making sure that, difficult as it is at hospitals at the moment, we're doing everything we can to smooth the flow of patients into hospitals, making sure we maintain social distancing and all of those things to keep our patients safe and to keep our staff safe.
You talk about some of the things that could be done in order to keep this level going, this at a sustained rate for many, many weeks, perhaps. I wonder if one of the considerations has been the use of the military. We've seen it before, military driving ambulances around London. Do you think that could happen again?
It's probably less likely. We have, as I say, some tremendous support from particularly the London Fire Brigade, where we've trained circa 400 of their staff to both do basic emergency on-scene care, but also obviously they're blue light trained, they can drive our vehicles. So we've got the flexibility to do that, to bring in more drivers, split our clinical crews to maximise the number of ambulances. We've got some help from our surrounding ambulance services, which we do as a matter of course across borders, and we'll probably be helping them in a few weeks' time as the virus spreads and moves around. So we've got ways of making sure that we can cope. We've had some support from the military through the year, but it's tended to be in specialist areas where they've had specialist engineers to be able to do work on our vehicles and things like that. So it's much more sort of targeted rather than actual frontline work.
So despite the obvious pressure on your staff and the people who are out there every single day answering those calls when they come in, for which, for whom we have nothing but praise, it sounds like you can cope. You've got the mechanisms to be able to cope as long as people don't ring 999 unnecessarily.
I think that's absolutely the message. Very much, the NHS is open for business, and although we're under incredible pressure, we're here for people when they need us most. And it's important that people do ring us if they get into a seriously ill or unwell situation and don't think that they feel unable to. But it's about using NHS services sensibly and wisely, using 111 as well as 999, using 111 online, using the wider GP network and primary care system, and then we will make sure that we're there for Londoners when they need us.
And just very, very finally, Garrett, have you seen many more members of the paramedic service, London Ambulance Service, being vaccinated over the course of the last few weeks? And are there plans in place to get many more vaccinated over the next few?
Yes, over the last few days now, we've been able to vaccinate NHS staff, and so we've been pressing forward with that as fast as we can. Clearly, our frontline crews are those most at risk, and that's where we're prioritising vaccinations.
Good to talk to you. Thank you very much indeed for coming on the programme. Garrett Emmerson, Chief Executive of the London Ambulance Service, to be honest, I thought that there was going to be much more doom and gloom about the possibility of London ambulance drivers not being there or answering calls much later than they would otherwise do. And it seems that although the pressure is enormous on them, that they are coping. And that, of course, is a very, very good sign for Londoners in particular, if they are having many, many thousands of calls every day, as they seem to be. 0345 6060 973 is the number, about what it is we're going to be asked to do in the coming weeks to lock down further, as the Prime Minister has hinted this morning, in order to protect the NHS. Do you think the NHS is well enough protected from what's going on at the moment? 0345 6060 973. We'll get a take on what is happening in intensive care in a few moments. Some really quite concerning statistics are out about the numbers of types of people who are in intensive care. We'll speak to the chair of the British Association of Critical Care Nurses as well. Tom Swarbrick here, Swarbrick on Sunday, 10:17.
This is LBC. Swarbrick on Sunday with Tom Swarbrick, live from Westminster on LBC.
Morning to you, 20 past 10 is the time. Swarbrick on Sunday here on LBC. Hope we find you very well this Sunday morning. Let me give you some of the numbers that are floating around about the pressure on hospitals at the moment, because I think they're quite instructive on what is happening, not just in London and the southeast, where this new variant is all over the place, but across the whole country. So, of the 17,900 new COVID cases in English hospitals since Christmas Day, 15,000 were new admissions from the community, 84% or so. These are figures from NHS England, by the way. New COVID admissions are now doubling in less than 2 weeks across 5 English regions, and COVID patients now occupy more than half of all beds in many areas and rising fast, including 63% of all beds in North Middlesex. So you can see where the trends are heading with this, particularly with the new variant, as I say, as it spreads up through the country, that hospitals are coming under increasing pressure. And in order to protect the NHS, which is what locking down does, I wonder if you think the NHS requires much more protection than it is currently getting, even with the Tier 4 restrictions. 0345 6060 973. Very keen to hear from you, and you will jump to the top of the queue if you are indeed someone who works in the NHS and you can tell us from your perspective what it is that is happening in the hospital in which you work. We'll talk about ICU and the details on the figures of people who are in intensive care in just a moment. Let me first run you through the front pages of the newspapers this morning. To start with some good news, because I think we all need a dose of it. The Mail on Sunday: new jab policy will save many lives. This is coming from Professor Jonathan Van Tan, the Deputy Chief Medical Officer, who says waiting 12 weeks between jabs rather than the original 3 will protect those most at risk of dying from COVID-19. This is a slight shift in strategy from the government about how they're rolling out the vaccine. We'll speak to a cabinet minister about that a little bit later. lbc.co.uk, pressure mounting on government to keep all school children in England learning from home when the new term starts tomorrow. As you know, lots of condemnation for the government on how they have handled the reopening of some schools. The teaching unions now threatening to sue. We'll speak to some of them a bit later. The Observer: teacher take legal action as chaos grips schools plan. Unions tell staff to stay away from classes. The Prime Minister has this morning hinted that school closures may well come around the country a bit later. Sunday People: don't let this be you. This is a woman whose mother died while they both fought COVID-19 in hospital, now warning, don't let this be you. Very powerful story in the Sunday People. Sunday Times: postcode lottery for life-saving jab. This is what they describe as a patchwork rollout, casting doubt on ministers' claim to vaccinate 2 million a week. I think it's fair to say that perhaps the government have had a bit of a problem with expectation management in some of this, that they've overpromised and slightly underdelivered. They cannot underdeliver on the promise of being back to normal by spring, would be my view. The Sunday Telegraph: we must not furlough our children's futures. Ofsted chief warns of dire consequences of extended school closures as unions attempt to impose total shutdown. Sunday Mirror: the story of Dale, the chap who got onto a jet ski to try and meet his lover on the Isle of Man. He battled with 6-foot waves to reach his girlfriend. He says, I felt like a word I shan't use on the radio, James Bond. He served some prison time for it. And the Sunday Express: Oxford jab is here, ready to roll out as the PM declares this is the year we will defeat COVID. Is hoping. Let's get a view on what's going on in intensive care right now. Dr. Duncan Robertson joins us, policy and strategy analytics academic from Loughborough University, who focuses on COVID-19 modelling and analysis. Thank you very much for joining the programme this morning, Doctor. You put out a Twitter thread last night, which I encourage people to read, which I found utterly terrifying. Can you take us through some of the details, please?
Well, what happens in ICUs is every time someone is admitted to ICUs, the statistics are created. So what has happened is there's been a release of statistics for the last 3 months, and basically it's showing who is in ICU. And I think, one of the sort of stories is, this is just a disease of old people. But if you look at who's actually in ICU, who gets admitted, the average age, and these are just of adults, this doesn't include children, the average age is around 60. But I think what's even more surprising is that a quarter are 52 years or under. So it's just not old people, of course, who are getting it. It's a disease of younger people as well. And I think, it was interesting listening to the Prime Minister today talking about schools and, deprivation. But one of the things is deaths from COVID aren't fair. they attack the most deprived. So if you look at who is in ICU, it's about you can split the population up into 5 groups, and if it was fair, you would expect that about 20% from each deprivation group would be admitted to ICU. But what we find is in the least deprived group, there are 12% admitted, but in the most deprived group, you get 31% admitted. So it's about 2.5 times. You're 2.5 times likely to be admitted to ICU if you're deprived. So one way of decreasing inequalities is to stop people dying of COVID.
And it's mainly men. It strikes me from the figures that you produced. Overwhelmingly it's men.
Well, that's right. And of course, one of the things that we find when we look at the number of people who are testing positive is we don't get so many people tested. What's called the positivity rate within men is very high. So it basically means that men don't get tested as much as they should compared to women. And so we're seeing these positivity rates very high. And that means that actually what we're seeing when they get to ICU is 2/3 of admissions to ICU are men. So it's, twice the number of men going into ICU than women. So it's not a fair disease. It attacks deprived people. It attacks men. But what's also surprising is it doesn't just attack people who are, unable to cope. So I think there are, you split it down into what people were doing before they were admitted to ICU with COVID. So 87%, nearly 9 out of 10 people were living unaided before they ended up in ICU. So it's not just frail people who are ending up in ICU. And of course, the really, the bad thing is, of course, ICU are very, very sick people, and around 1 in 3 or a third die when they're in ICU. So, I would kind of say, what is the government trying to do? We talked about, it was very clear in the wave 1, it was stay at home, protect the NHS, save lives. That was very clear. Right now, it's only in certain areas it's stay home. So the protect the NHS and save lives, I think, is being a little bit reduced in its importance. So I think, I would ask, what is the government trying to do? Because we do have a way out, and that's the great thing. We have vaccines coming along and are being delivered to hospitals.
One would also hope that the treatments would be getting better for people in those hospitals, and the chances of survival were much better. Doctor, thank you so much. Dr. Duncan Robertson, Policy and Strategy Analytics academic from Loughborough University, focusing on COVID-19 modelling and analysis. Let's speak to Nikki Credland now, chair of the British Association of Critical Care Nurses, senior lecturer at the University of Hull. And we've heard some of the background from the doctor there about the stats. Tell us what it's like on the ground floor in those ICU wards, and how you are coping with the numbers coming in.
Yeah, I think there's a couple of things that I would maybe just like to pick up on. The previous speaker spoke about ICU mortality, and I think it's a really important message to say that our treatments of COVID-19, particularly from an intensive care perspective, have improved dramatically from when the virus first hit. So our mortality rates are much improved, and we know we don't want to scare the public that every 3 patients are going to die, when actually that's not actually the case. So it's a really important message to get out there. In terms of where we are from an ICU admission perspective, we're seeing huge rises in ICU admissions and hospital admissions. And those rises are not only great in terms of number, but are presenting a problem because of how quickly they're happening. So they're not giving us chance to be able to get prepared to the degree that we would usually do for hospital admissions and for ICU admissions. And that's happening across the country.
Yes, and there are reports in the papers this morning, Nikki, I'm sure you will have seen these too, that some patients in hospitals where they really are struggling to cope, where there are no more ICU beds, they are potentially going to be transferred to other hospitals around the country, sometimes hundreds of miles away, that have more space. Do you think we're going to see a lot more of that if the rate of people going into ICU continues at this pace?
Yeah, so we already have that in place, and that's already happening throughout the country now. That's not something that will happen, that is happening. So once you've already existed your normal bed capacity, you've opened surge capacity beds, and you've used up all of your surge capacity beds, the only option then is to look at mutual aid, and that means transferring either patients or staff or equipment to other hospitals within a geographical location to be able to spread that workload out a bit more effectively. The problem with that is there comes a point where it's not possible to do that anymore either. And if the NHS gets overwhelmed from a national perspective, we won't be able to utilise.
And how close are we to that point, Nikki, do you think? How close are we to too many ICUs being full?
So we are seeing massive rises in ICU capacity. What's happening is that some patients that would be traditionally looked after within a level 2 or a full ICU environment are being managed on respiratory units, for example, patients that need non-invasive ventilation rather than fully invasive ventilation. So that's calming it down a little bit for us. But what that's meaning is other areas of the hospital are becoming significantly overwhelmed as well. So being able to redeploy staff into intensive care to support intensive care with those numbers of patients is becoming more and more difficult.
And so, therefore, breaking that rate of people coming into ICU is going to be really important over the next few weeks. Nikki, thank you so much. Nikki Credland, you are chair of the British Association of Critical Care Nurses, senior lecturer at the University of Hull. So, to go back to the doctor's question, what is it that the government is trying to achieve? What are they trying to do in order to protect the NHS? We'll be joined by the Cabinet Minister, Liz Truss, in just a few moments. Tom Swarbrick here, Swarbrick on Sunday, 10:31. News headlines, Thomas Watts.
The chief executive of the London Ambulance Service has told Swarbrick on Sunday on LBC the service is busier than it's ever been. Garrett Emmerson has urged the public to stick to Tier 4 restrictions to help reduce the sustained pressure on staff. Ministers have insisted coronavirus school closures in England will only be used as a last resort. The government is under growing pressure from education unions to keep teaching online at the start of term. Hundreds of new coronavirus vaccination centres are preparing to open across the UK next week. Around 500,000 doses of the newly approved Oxford AstraZeneca jab have begun arriving at hospitals and GP-led centres. And the weather rather cloudy in England, Wales and eastern Scotland. Rain across coastal counties in the northeast with some wintry showers developing inland. Brighter spells in the west, a high of 5 Celsius.
This is LBC. You may Swarbrick on Sunday with Tom Swarbrick on LBC. Text 84850.
Morning to you, 10:36 is the time. Come to your calls in just a few moments, but I'm joined live by Liz Truss, the International Trade Secretary, Minister for Women and Equalities and MP for South West Norfolk. Thank you very much indeed for coming on the programme, Secretary of State. Very Happy New Year to you. Lots to discuss, including vaccination rollout and, of course, managing the COVID crisis. But I do want to talk about your brief because it is very important and hasn't had a lot of airtime. So when it comes to going around the world and making these trade deals that you have been able to do, where do you think it is that the UK should diverge further from the EU that would allow us to do even better, more productive trade deals?
Well, in terms of the trade deals we've done, the one where we have diverged from the EU and what they're prepared to do is Japan. And we've gone further and faster in data and digital and services. And I think that's the opportunity for the United Kingdom. We have an opportunity to be more forward-leaning on those types of policies in areas like the free flow of data. We've got one of the world's leading tech industries. And what I want to do this year is accede to the Trans-Pacific Partnership. That's a group of 11 fast-growing countries, create a cradle of trade deals around the world. And that will help our technology industry, which then can sell its goods direct into those markets around the world. And it will help us recover from COVID.
And you think it's those areas of divergence from what we were able to do inside the EU that is going to provide the greatest benefit for those markets with, I know that you're trying to sign deals with Australia and New Zealand, for example.
Yes, and I think the digital and data and services are the areas where the EU has been particularly protectionist. And certainly in respect to Australia and New Zealand, we want advanced provisions on financial services. We want advanced provisions on technology. And we also want to work with them to help create global rules that are going to move the world in a less protectionist direction. Because over the last few years, we've seen more countries putting up trade barriers. We've seen a reluctance to engage on issues like digital trade. The WTO rules haven't been seriously updated since 1995. So I think this is an area where the UK can really show a lead. The other area I'd highlight, Tom, is things like gene editing, where the UK can show real leadership as well and where we can do different from what we previously had done in the EU.
And financial services is something that the UK is known for and does very well. One of your colleagues, Ian Duncan-Smith, said a few days ago that we could dominate the world again. I wonder if you share that view.
I think in many ways we already are a leading player in the world. London outperforms in areas like fintech already. And I think it's the combination of financial services and technology that we're particularly strong in. So one of the things I've just launched is a new digital economy agreement that we're negotiating with Singapore, whereas two hubs in technology and financial services.
So we're already dominating the world. Ian Duncan-Smith need not worry. The domination continues.
We need to continue, because if you sit on your backside, then others will try and overtake. So it's a continuous effort to build new, more exciting and more advanced agreements, working with like-minded partners like Japan, Singapore, Australia, New Zealand, Canada, the United States, who take a more forward-leaning approach on these issues.
It's something that we could spend a lot of time talking about. Indeed, we probably should spend a lot of time talking about at some stage in the future. But I do want to come to events regarding the pandemic and the management of it. So what was it that changed on Friday to mean the Education Secretary was forced to close the remaining schools in London for Monday?
Well, every day, we are getting new data and information about COVID. And the fact is that we have had this new variant, which is more infectious.
Yes.
Rates have risen faster.
But that was known a couple of weeks before Christmas. So was there something on Friday that happened that meant that the Education Secretary's hand was forced in order to have to close those remaining schools?
As a government, we are constantly reviewing and updating our information and our plans. And the alternative to doing that is that we would have to lock more of the economy down. So I think it's right to be more flexible, be prepared to take decisions at relatively short notice when the alternative is closing down schools, which we know is very, very detrimental to children's education. So that's the choice we face, is having more of a blanket approach that ends up with more of the economy being closed down, more children's education being affected. And I think the Education Secretary is right to do all he can to keep schools as open as he can, because we know already the implications it's had for children on the lowest incomes, and we don't want to see any more of that.
But people understand, I think, that if the situation changes, then the outlook changes and the decisions have to change. How then can you guarantee that exams will go ahead at the end of this academic year?
It's vitally important that exams go ahead. We know the difficulties that we had last summer, and I think it's right that students have a fair chance to show what they've achieved, and we know exams are the right way. But that's certain,
is it? It's absolutely guaranteed, absolutely nailed on that exams will definitely happen at the end of this academic year. Okay.
Absolutely. And let's remember, we are making huge progress on vaccinations. But there is going to be a very
which we'll come to. Don't worry, Secretary of State. Well, I'll come to that, I promise. The Prime Minister has said this morning that schools are safe. If they're safe, why are they being closed?
The issue is, in particular parts of the country, namely London, because we have this new variant of the virus, which is very infectious, the schools have had to be closed as part of an effort to contain the spread of that virus. Schools are safe. We've put in place measures. Teachers have worked incredibly hard putting in place measures. We're rolling out lateral flow testing. But if they're
safe, why can't they remain open? As you say, it is absolutely critical to kids' education to have them open.
The
truth is they're not safe enough, are they? The truth is they're not quite safe enough in order to stop the flow of the virus moving from pupil to teacher to parent or whatever. That's the truth.
This is a very, very difficult situation that we're in because of this new variant that is highly infectious. And the difficult decision has been made to close those schools in London for a limited period of time. That is the reality of the decision that's had to be made. But as I've said, the vaccine is coming on stream. Lateral flow testing is coming on stream, and we want to open those schools as soon as possible, because we all know the Zoom lessons are not as good.
They're not great. They're not great. Homeschooling in the Swarbrick household is not good, from me anyway. But the Prime Minister has talked about restrictions in England are probably going to get tougher, probably about to get tougher. What could this look like then? That seems to me like more schools are going to have to close.
I'm not going to speculate on what further decisions might have to be made. This is something that we are constantly reviewing and monitoring. But the fundamental principle is closing schools is an absolute last resort. And we want to keep schools as open as possible.
You are a mum, and I don't know whether your children are of school age. Would you be sending your children to school tomorrow?
Well, my children are both at school in London, and they're secondary school students, so they are Zooming from home. And I'm extremely keen for them to go back to school.
Let me ask you about Let me ask you about the vaccine then and the rollout, because that is the good news. So what actually is the plan for the vaccine rollout? How is it going to work?
So we've already vaccinated over 1 million people in the UK, which is the highest number of any country in Europe. So we've already made strong progress. There's 530,000 more vaccines coming on stream tomorrow. And, we are working really, really hard to get more vaccines out. So we have tens of millions going out in the next few months.
And there are concerns in the papers this morning about the areas that are set up in order to administer these vaccines and whether there are enough places available for people to go to have a vaccine. Israel has vaccinated at an incredible speed. I mean, they're really racing through people, and they're vaccinating people in their cars. They're sort of drive-through centres where you can be vaccinated. Could we see that here as a way of speeding it up?
Well, I'm sure we're looking at every possible option. We've already rolled out 700 vaccination centres. I think a further 100 are in the pipeline to make sure we've got good coverage across the country. And of course, we'll learn from other countries as well. By the way, Israel is another country that we will be doing a further trade deal with and looking at areas like technology and innovation.
Absolutely, it's good to know. As I say, come on to that at another time. The other thing that Israel is doing is that it is giving green cards to those people who have had the double vaccination, both doses. Could we see that here? That's a way of being able to show that you've had the vaccine to be able to go on holiday or to not have to have tests, COVID tests, before you get on a plane. Could we see that here too?
We don't have any plans for that.
And there are no plans to make that happen?
That's my understanding.
OK. Tony Blair wrote the other week about changing the vaccine policy to mean giving one dose to as many people as possible, which is now what the government has adopted. He also said that health passports, which I think is what we're talking about, are inevitable. You disagree?
Well, I mean, we constantly keep our policies under review, but that is not planned at present.
OK, so it could you might have to introduce these passports, but you're not sure yet whether you're going to need them. Is that a fair summation?
As I say, we don't have any plans for that, Tom.
OK, and just finally on this, the Chief Medical Officer says that you could reach 70% protection from one dose. And I think it's quite, it seems pretty reasonable that rather than wait on a second dose to be given to someone to get 95%, you give as many people 70% as possible. What is the evidence for that 70%? And would it not be sensible, given the debate that we're having about schools, to start vaccinating teachers very, very quickly as well?
Well, there is strong evidence behind the procedure which we're adopting of making sure that everybody, or as many people as possible, get that first jab or injection, whilst at the same time making sure that people get the second jab within 12 weeks. I think it's important to note that our vaccination policy is set by an independent body, the JCVI, who decide which are the priority groups to be vaccinated. And I think that's right. I don't think it's right for politicians to be in the position of making those types of decisions.
Good to talk to you, Liz Truss. Thank you. Good luck with those Zoom lessons. International Trade Secretary, Minister for Women and Equalities, MP for South West Norfolk. We'll speak to the Shadow Minister for Schools, Labour MP Wes Streeting, in just a few moments as well. Tom Swarbrick here, 10:48.
Eddie Mair on LBC.
Nicky Aiken is Conservative MP for the cities of London and Westminster. Does it make any sense to you that these restrictions will be reviewed next Wednesday?
I hope we can come out as soon as possible.
Yes, we know all of that too. I'm asking you whether this makes any sense.
Whether it makes sense or not, we are in the situation we are in.
It's got to make sense. Why on earth should people adhere to something that's nonsense?
Eddie Mair, Monday to Friday from 4 p.m. LBC. This is LBC, Swarbrick on Sunday, with Tom Swarbrick, live from Westminster.
Morning to you. Here's Savannah on 84850. Tom, isn't the simple answer to close all schools for 1 week and spend that week vaccinating all the teachers? I really don't understand why that isn't the priority, she says. We'll speak to Wes Streeting, the Labour MP, Shadow Schools Minister, in just a moment. Oliver, though, is in Bexley Heath on the subject of the NHS. How's it coping, Oliver? Hi.
Yeah. So I'm operating department practitioner. So I work very closely with the anaesthetist pre-operation. So I'm the one that will assist him as you're going off to sleep for an operation. And I currently work for an elective surgical site, which is linked to a local district general hospital, which we've actually had to close now because of the capacity that and the pressure that our district general hospital is under.
Did you close last time around? In March?
Yes, we did. Yeah, so we closed and we were all redeployed over. We still kept an emergency theatre, a trauma and orthopaedic theatre open. But other than
what does that mean for
our
people, Oliver? Yeah, what does that mean for people who are having that surgery? It's just going to be postponed again indefinitely.
So it's postponed. You're obviously on a list pre-March to come in and have your operation. I've spoken to people that have had hip replacements and knee replacements that were due to have it in February, and then it's just been delayed. But what I don't think people understand is that people that are waiting for these hip replacements are quite uneasy on their feet anyway. So the more their surgery is delayed, they're at more risk of having a fall, maybe fracturing their hip, and then they end up coming into A&E and eventually on a ward anyway.
Does that mean then, Oliver, your view is we need to lock down harder now to give the NHS more breathing room so that elective surgeries like yours can carry on doing what they're doing?
Yeah, because at the moment we'll be covering. When we reopened again, we was doing waiting lists on a weekend to try and get rid of this backlog. What we did notice the previous lockdown, me and my colleague was saying that actually the lockdown did work because it reduced this number of patients that were coming in again.
Yeah.
But for the hundreds of people that are protesting against anti-masks and anti-human rights, I would probably suggest to them maybe coming in and doing some volunteer shifts on a ward.
Well, I think it's been very clear, Oliver, in speaking to people that the situation in some hospitals, particularly in London and the South East, is really, really very tricky indeed. Thank you so much for what you do. Thank you very much indeed for your call. Let's turn to Wes Streeting, Shadow Minister for Schools, Labour MP for Ilford North. Thank you for being there for us this morning, Mr. Streeting. Councils around the country now outside of London and the South East are suggesting that they're going to keep schools shut. Are they doing the right thing, do you think? Morning to you.
I trust the leadership of those local councils and those local leaders far more than I trust the leadership of Gavin Williamson. Listening to the Prime Minister this morning, I think it's inevitable now that there'll be further school closures. And worse still, with the schools he already has announced the closures for, he can't even guarantee that those schools will be open on the 18th of January. Worse still, those pupils who are not going to be at school in the coming weeks don't even have the high-quality remote learning, access to laptops, access to broadband that we've been campaigning and calling for months. So it's a total...
Mr. Streeting, how could there be a guarantee that schools could reopen after 2 weeks of lockdown? We don't know what the numbers are going to be like or what the capacity in the NHS is going to be like.
Well, you're right in where we are today with schools is a reflection of the fact that the government has lost control of the virus. It didn't need to be this way. Both on the public health front, we've learned time and again that when government dithers and delays and is too slow to act, that shores up bigger problems in terms of health.
Would Labour have kept schools shut not just potentially before Christmas, through the Christmas holidays and then after into January? You'd have kept them closed the whole time?
Well, look, frankly, if we'd had a Labour government and had the government listen to what we've been saying from opposition, we wouldn't be in the position of schools needing to close full stop. We made it very clear that schools needed the funding they need for the safety measures. That wasn't delivered properly. We said months ago the government needed to roll out mass testing to avoid this scenario. They didn't listen, and they only announced it on the eve of Christmas, just as schools were going away.
So schools aren't safe enough? They don't have the right kit. They don't have the ability to make it COVID secure. Then, as the Prime Minister said, schools are safe. You're saying they're not.
I don't understand how the Prime Minister could sit on the Andrew Marr programme this morning and say in one breath that schools are safe and then the other breath say that we've closed them in huge parts of London and across the southeast. And I think it's reasonable that people in other parts of the country are saying, well, if it's not good enough for London and the southeast, why aren't schools in our tier 4 areas closing? And it's also reasonable, by the way, that whether teachers, school leaders, support staff, parents, pupils have lost total confidence in the government and their ability to keep schools safe and to keep schools open. And that's why we've ended up in a pretty unprecedented statement from all of the education unions yesterday.
Yep, and we'll speak to them a bit later on. But do you think it is actually possible to make a primary school, my son's in year 1, is it really possible to make sure that they keep socially distanced from one another in a way that means that there isn't a spread of the virus?
Well, Tom, if the government had got a grip on the public health situation and on the spread of the virus, that would ease pressure and burden on schools. If the government had listened to us on
keeping the schools closed.
If the government had listened to us on mass testing, then that would have eased the pressure on schools. If the government had listened to us on funding of safety measures, that would have made the lives of school leaders easier and given more confidence to parents and staff. They didn't do any of these things. Mm-hmm. And where we are today, and frankly, where we will be tomorrow in terms of the chaos and confusion, is entirely as a result of the government's failure, both on the public health front, but also treating education as a total afterthought throughout this pandemic.
And just finally on this, if schools are not reopened on the 18th of January, are Labour going to say that they've been closed for too long?
Well, as I say, no one wants schools to be closed. And by the way, people will be bashing the teaching unions today. They don't want kids not to be in school. They've been forced to this position because the government's lost control of the virus, has lost the confidence of parents.
So you're saying 2 weeks of school closures and then that's it, and then we can go again because nobody wants this. We all want the kids back in school.
Two things. The government has to do everything they can to get control of the virus and create the conditions in which schools can open by the 18th of January. The second thing they need to do is make sure that in terms of the support put in place for kids who've lost learning, the preparations for exams later this year and whether they can go ahead, whether we need a plan B, the mass testing, the safety measures, government should be ahead of events, not behind events. And it's because of their failure to treat education as a priority that schools are in this mess.
Wes Streeting, good to speak to you. Thank you very much indeed for your time on the programme. Shadow Minister for Schools, Labour MP for Ilford North. It is to schools I want to turn. Over the course of the next 60 minutes, as Mr Streeting alluded to, teachers are taking legal action now as chaos grips schools' plan. According to The Observer, the planned reopening of schools descended into disarray as unions advised teachers not to return to the classroom. Heads took legal action over the government's plans, and senior Tories warned that school gates may have to remain shut for weeks to come. If your child is due to return to school tomorrow, are you going to send them? The Prime Minister has said this morning that schools are safe. If they are safe, why are some of them having to shut? And we'll speak to the council leader at Brighton and Hove that had taken the decision upon themselves to say to their heads, don't reopen.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 11 o'clock, ministers have insisted primary schools in England are safe ahead of the return to classrooms tomorrow. Education unions say closures in London to tackle the new variant of the coronavirus should be extended across the country. The Prime Minister's suggested tougher restrictions are on the way, but the International Trade Secretary Liz Truss has told LBC that schools will always remain open where possible.
I'm not going to speculate on what further decisions might have to be made. This is something that we are constantly reviewing and monitoring, but the fundamental principle is closing schools is an absolute last resort.
The head of the London Ambulance Service has told LBC that crews are the busiest they have ever been. NHS services in the capital and across the southeast of England have been struggling to cope with a rising number of coronavirus infections. Garrett Emmerson has urged people to observe Tier 4 rules. He's told Swarbrick on Sunday paramedics are responding to more calls than during the first wave of COVID-19.
It's continuing to be at that sort of level of 7,500 to 8,000 calls every day. So it's the sustained pressure that I think is different. In the spring, we saw those kind of numbers or just a little below those kind of numbers, but for a very short period. We know this time, because it's the winter rather than the spring, it's likely to be more sustained.
The Scottish Parliament will be recalled tomorrow morning following a cabinet meeting to consider further coronavirus measures. MSPs will hear a statement from First Minister Nicola Sturgeon over concerns about the spread of the new variant. 11 Republican senators have joined Donald Trump's efforts to overturn the presidential election result. They've pledged to reject Joe Biden's victory without a full audit of the process. The move, led by Ted Cruz, is unlikely to prevent Mr. Biden's inauguration later this month. And parts of England, Wales and Scotland are facing snow and icy weather over the coming days. A yellow weather warning is in place across northern England and Scotland, with significant snowfall possible by the end of the week. And today's weather, rather cloudy in England, Wales and the east of Scotland. Rain across coastal counties in the northeast with some wintry showers inland. Brighter spells in the west, a high of 5 Celsius. From Global's newsroom, I'm Thomas Watts.
This is LBC from Global, leading Britain's conversation. Swarbrick on Sunday with Tom Swarbrick on LBC.
Very good morning to you. 4 minutes past 11 is the time. You're listening to Swarbrick on Sunday here on LBC. I'm Tom Swarbrick. Hope we find you very well indeed on what is a tricky Sunday morning, I think it's fair to say, particularly if you were planning on sending the kids back to school on Monday. The Christmas holidays coming to a close. For those of you in London and in parts of the South East, the opportunity to do that has gone. Gavin Williamson, the Education Secretary, on Friday, deciding that in the end, yes, all London schools were going to have to shut until a review takes place on January the 18th because of the spread of this new coronavirus. The Prime Minister hinting this morning that tougher measures will have to come in the next few weeks. He didn't say so in terms, and neither did Liz Truss when I asked her cabinet minister, saying that it will be schools that close, but it feels like that is where this is heading, isn't it? Particularly if you find yourself in a Tier 4 area. So, are you still planning to send your child to school tomorrow? If you work in a school, are they, as the Prime Minister said, safe? 0345 6060 973. There are plenty of takes on it, depending on the kind of paper that you pick up. The Sunday Telegraph is talking about not furloughing the future of a generation. The Observer looking at the teachers that are taking legal action against the government, as they say the plan to reopen schools in England descended into disarray last night. Unions advising teachers not to return to the classroom. If you work in a school, will you be going back, or will you in effect call it a strike? Is it a strike? I don't know. 0345 6060 973. Let's turn to Devi Sridhar. Professor Devi Sridhar, Chair of Global Public Health at the University of Edinburgh. Very good to talk to you this morning, Professor. Thank you for coming on. The Prime Minister suggests that schools are safe. Is he right?
Well, I think we need to be careful with this term safe. I mean, the question has always been, are they safe enough? And what are the measures in place to actually protect schools? And the worry here is not about opening schools. It's easy to say we're going to open schools. What is hard is keeping schools open if you have substantial community transmission, because we know kids are going to arrive into school testing positive, whole bubbles are going to be sent home, teachers are going to have to isolate, and that's not sustainable education. So there is a case to be made of getting your numbers low enough so you can actually run schools quite normally, rather than actually having to come this stop, start, because you keep having cases in schools and have to get kids out to isolate.
Yeah, that absolutely happened to us. My son was off school in 2 separate occasions because there was an issue with a bubble further up the school that meant that the school had to close. Does that mean, so why 2 weeks then? Why the 18th of January, do you think, as a point at which to review the decision?
Well, so this is also similar to what we're doing in Scotland. So before Christmas, the decision was made to delay the return of schools to the 18th of January. And that was really for 2 reasons. The first was because there was, the worry about this new variant and increasing transmission, and the idea of, could we wait to see if restrictions would work? Could we get our numbers low enough by then to be able to have our community transmission controlled? And the second thing was around, there is still some unknowns about the new variant and exactly how does it transmit? How transmissible is it? What does this mean within school environments? points. And so I think it's just assess more data and more evidence and see how things evolve in the next week or two before, in a precautionary way, rather than just saying schools are open and then regretting that decision later.
Yeah. And presumably also getting that testing in, which has been talked about a lot, so getting those lateral flow tests into schools, whether it's the army that are doing it rather than teachers, whatever, just get kids tested quickly in order to keep the schools open where they can be. I wonder what you make of vaccinating teachers, as Israel is doing. They are moving very, very quickly to vaccinate certain types of professions, teachers being one of them. Do you think that should happen here?
Yes, so I think as a matter of principle, yes, we should, of course, be vaccinating teachers, starting with secondary school teachers. But the problem we have now is we don't have enough doses for all the groups who need it. And so the terrible trade-off that has to be made is, do you vaccinate those who are most at risk of death and dying, the most vulnerable, people's lives you could save, or do you vaccinate teachers who maybe are, lower risk in terms of their own personal risk of dying, they might be younger or healthier, but actually because you want to keep schools open? How do you balance children being out of school with people losing their lives? I mean, these are the terrible kind of trade-offs that governments have to make. So this is kind of why we need to get more doses, because that solves that allocation problem.
Yeah. And what would you say about how the government is approaching the measures that are, they say, going to be needed over the course of the next few weeks? Is there an argument to say, well, we know they're going to be needed in a few weeks, so why not just implement them now in order to keep cases as low as they possibly can be?
I think, we've been in these reactive cycles in the UK. The government seems to wait until things go really badly and then quickly U-turns and tries to correct it. And I really would like a more proactive strategy, which is, what are we trying to do with this virus? Are we trying to live with it, which means living under restrictions? Are we hoping the vaccine's going to solve everything? But then we better make sure we have good travel restrictions in place, or look out for new strains, because all we need is a mutation and the vaccines may not be as effective. So I kind of feel like right now we're quite reactive, where I would much prefer a proactive strategy, which is, what are we trying to do with this virus? How do we survive the next 6 months without crashing our economy and living, under lockdown for now, 7, 8 months, 9 months, for the next 6 months? So that's, for me, the bigger question for government, which is, what is your plan beyond just waiting for everything to go really badly and then saying, oh no, we need to lock everyone in their homes?
Professor Jevi Sridhar, always a pleasure to talk to you. Thank you for coming on, Chair of Global Public Health at the University of Edinburgh. Listening to that at 11:09 is Richard Sheriff, President of the Association of School and College Leaders. He also leads a group of schools in Yorkshire. Thank you very much for your time this morning, Mr. Sheriff. Will you be encouraging your pupils into school, or the teachers that teach in those schools, to get back into school, into the classroom, to begin teaching tomorrow?
Well, it's a really complicated start to term, isn't it? And very confused for us. Just listening to the professor talking there, I was extremely sympathetic towards her view. We're being very cautious. We obviously respond to the direction from government, and that's saying that, for secondary age pupils, they're not back in this first week. So we've got a kind of respite there to see what's going to happen this week. For primary age students, it's even more complex. We know how worried teacher unions about sending staff back in and their view about the safety of young people. And again, we're sympathetic towards that because we haven't got evidence to the contrary. We are, like the professor, worried about this new strain of the virus, how quickly it spreads within schools. We don't think it's right to wait till things get dreadful before we actually take further action. We, again, like her, would like to be more proactive in this. We understand the complexities, but this is really, really hard. And the other point I would just make is that...
So what are you saying to your members? Are you saying follow the government advice and go back into school, or are you saying let's just pause on this for a week until we can work out what we're doing?
It's not our position as an association to tell members what to do. They will make their own decisions in their own schools, their own trusts, their own governors. What we are saying to government is, please, we think governments should now call for schools to remain closed for the first 2 weeks, for these next 2 weeks, to allow exactly what the professor just said, to look at the evidence, look what's happening. If testing is the right way forward, to get that in place properly, but not rushing to some kind of disaster after the first 2 weeks. We should take our time to think about this carefully and do it in a moderate and sensible way.
And what is the end goal is then what? The quick mass testing of students and pupils in any given school in the country? Because I think people might start to see this as a bit of the thin end of the wedge. People will politicise it if they wish, but from unions who are trying to put pressure on the government to keep schools closed in order to embarrass the government, that we move from, 2 weeks of school closures to 4 weeks, to 6 weeks, to 8 weeks, and then we're back into a situation like March and April.
Well, let's get one thing straight. For leaders across schools across England, Scotland, Ireland, Wales, none of them want schools to be closed. That's absolute fallacy, and none of us actually want to embarrass the government. I certainly have no wish to do that. We understand the difficulties of governing at this time. We're leaders. We share that kind of nightmare scenario, But we have to be clear about this. We do not know what this virus is doing. What we do see is what's happening in London, and we're told by the medics, and SAGE has said that this is going to run north, it's going to run everywhere. In which case, don't we need to preempt this? Don't we need to take action now rather than wait for those volumes of people to be queuing in hospitals, up and down the country? As a teacher, as a leader, as somebody whose son works in a COVID ward in a hospital, I feel passionately we need to do this right sensibly. And I don't think we've got that yet. And I just pick up your point about testing, because that's a really interesting one. Yes, the rollout of mass testing, it's not the answer. The answer is vaccination. What mass testing might be able to do is limit the number of children staying at home. But again, we've got significant doubts about how that can be implemented. And actually, no doubts whatsoever. I'll tell you now, we cannot implement what the government has asked us to do by Monday, the 11th of January. It's impossible. We just have not got the facilities. Even with military help, even with the resources of the armed forces coming in and doing it themselves. The armed forces have not been asked to help us directly. They're there to help us in a remote way, to offer advice, and only those schools that are really struggling. If you speak to any leader of a large secondary, once you've worked through the numbers and the numbers of spaces you can use and the people who can get testing, even though you can get people to do it, you physically cannot get through the numbers each day to be able to achieve that by Monday the 11th. Whatever anybody, it cannot be done.
So if the answer is, the ultimate answer is vaccination, of course, because that hopefully makes the whole thing go away. And we heard from Liz Truss, the cabinet minister, a little earlier, saying that this is a decision made by an independent body about who is vaccinated. Is it your view then? Is it the view of the unions that teachers should be moved to the top of that priority list now?
Well, I don't speak for all the unions representing people working in schools. I speak for Association of School and College Leaders. But I can say, from what we would say, is I think definitely that teachers should be up on the priority list. However, we do have to, as the professor was saying, there are limited amounts of this vaccine initially. We have to be careful that we don't prioritise one group over another at the expense of people losing their lives. So those vulnerable people, who are 80 plus or 65 plus, do deserve that vaccine before I do, before others do in the school system. So it's a matter of, that's why it's important perhaps to take that break now to say, look, let's take it calmly. Let's get the vaccine working in school. Let's get teachers vaccinated as soon as possible. But let's not rush back into a school situation and make things worse.
But if it can't be teachers that are moved to the top of the vaccination list because of the problems with getting the vaccines in, or with that moral dilemma, and if testing is not the answer either and you can't do it and the army aren't particularly helpful because they're helping in a remote way, then we are looking at weeks and weeks and weeks of schools being closed, with kids foregoing an education that it is their right to have, and that there is a moral duty to carry out.
Yeah, I completely agree with the moral duty and the real duty to get kids back into school and to educate children. Now, we have made big steps in terms of remote learning since this first kicked off, some months ago now. So we can do that better, but it is no substitute for being in school. And we hate seeing kids languishing at home. It's just not good for them. But, and this is the problem, we are just part of this. This pandemic affects all parts of our society. The schools is one section of it. We know most of the infections we see in school are through community transmission. So we need to work together as a whole society to deal with this threat. It can't be just schools. By saying to schools, above everything else, you can't go near people in shops, you can't do this, but you can safely go into a school. We've managed that so far. What the game changer has been for us is this new version of the virus coming that is much more transmissible. And that's really, I suppose, shaking the confidence of parents, proper children, and teachers and those who work in school about being able to come back safely. And we need to understand how we can continue to do that and have that explained by us, by the science. And what we're asking for, we're not asking to stop schools opening. We're asking to understand, to have our questions answered by government, and then we can get on with giving every bit of support the profession can to getting kids back in school.
In a sentence, then, the chances are that the schools that are currently closed and the schools that are probably about to be closed, they're not going to reopen on January the 18th, are they? That would be your hunch, would it, this morning?
My hunch would be that schools will stay more closed than not during up to 18th. I think we'll have to look very carefully at the evidence and what it says, whether they should continue to close or not from the 18th. I do not know how the virus will develop.
Okay, good to talk to you. Thank you for your time. Richard Sheriff, you're the president of the Association of School and College Leaders and also leads a group of schools in Yorkshire. 0345 6060 973 is my number. If you work in a school, if you were planning to send your children to school on Monday, have you changed your plans based on what you've heard over the last few days? I think it is absolutely right that the government have said that keeping schools open is the priority. It has to be the priority in order to, if you're going to shut hospitality, you've got to try and keep the schools open. That seems to be a reasonable enough trade-off, even though, of course, it's very difficult for pubs and bars and restaurants. So closing them is a massive last resort. And it just seems to me if union leaders are saying, well, testing's not the answer and we're not going to be vaccinated quickly enough, then we are looking at weeks and weeks and weeks, possibly months, of schools being closed while this new variant makes its way around. And maybe that's just the reality of it. Maybe that's just what is meant by a very difficult few weeks and months. But surely there's got to be a way of doing it to allow schools to maintain a presence in the lives of our kids. Maybe it comes through much greater testing. Maybe that is part of the answer, if not the whole answer. And schools and unions get with the programme and get the Army's help to be able to test more people. 0345 6060 973. Come to your calls in a few moments. Tom Swarbrick here, 11:18.
LBC. Swarbrick on Sunday with Tom Swarbrick on LBC. Call 0345 6060 973.
Morning to you. 11:21 is the time. The front page of your Sunday Telegraph this morning, the Ofsted Chief Inspector saying that we should not be furloughing children for months while Britain waits for coronavirus cases to subside. In a rebuff to those calling for all schools to stay closed indefinitely, Amanda Spielman said that children's time out of classrooms should be kept to the absolute minimum. Problem is, it doesn't seem to me that people can agree on what the absolute minimum is, and indeed what should be done in the time that schools are closed in order to make sure that schools are closed for the absolute minimum. We'll come to your calls. Jane's in St Albans. Hi there, Jane.
Hi, good morning.
Hi. Your thoughts on what we should do here?
It's not so much about what we should do. My son is sitting his A-levels this coming year. He is in a school in Hertfordshire where currently primary schools are going to be closed for at least until, I think, the 18th. Yet he's due back in school on the 11th to sit his mocks. And I don't understand how it isn't safe for the primary school kids to go back in the same school, but it is safe for my son to go back and sit with his year group in the exam hall and sit his exams. It just, I don't understand.
Yeah. Isn't it? I don't know the answer, but just top of mind, isn't it just a case of volume, just of numbers? Primary school kids are running amok; they're all jumping on each other. Whereas if your son is sitting, and I realise it's a cause of concern, of course it is, but if your son is sitting an exam, just remembering back to my own exam days, they're quite spaced out. Those chairs,
yeah,
those
they are.
desks,
But there's an awful lot of time before, afterwards. Primary schools, you could equally argue, are much easier to keep within a small bubble of their class. And not have them interact. My son's in an entire year group, that's his bubble, and all their parents and everything they do is what comes home to my house. He's already been off of school because of what's happened with other kids coming into school, presumably once they've even had a test, and then go, oh no, it's positive. And he's been off, and that has a knock-on effect to my mother, who hasn't had any physical contact with a person since March.
So, of course, much better.
She can't be near anyone.
Much better for you, for your son, for your mother, is to get your son tested as he's leaving the exam hall or as he's going into the exam hall with any of these rapid turnaround lateral flow tests. That might be part of the answer here.
That would be fabulous if I thought the results of those were better than a 50-50, which I think 50-60% accurate, which doesn't instill a huge amount of...
No, I think it's a bit more than that in most of them, but it's not as accurate as the tests that go off to the labs.
No. So, I mean, it's great, and it would be great if he could have it every time or before he went in. That would be great.
And the plan, Jane, you're still going to set... Sorry to interrupt. He's still going to go in, is he, as it stands tomorrow?
Because it's his... Well, he's not going to go in tomorrow. He's going in on the 11th. That's the last update we had. At the moment, he has to, because I don't know where I would stand if he didn't sit his mock exams, especially as that may be what he ends up... if they don't end up sitting their exams.
Quite. That's a very good point. I hadn't thought of that, Jane. That's a very good point. Good luck to your boy, by the way, in taking those mocks. It's a horrible thing to have to do these exams. Delighted when I never had to take an exam again. Thank you very much indeed for your call. Good luck to him. Chris is in Tower Hamlets this morning. Hi there, Chris.
Hi. It's really important. I'm a retired secondary school head teacher. It's really important that you get more people like your previous guest, not than the man who speaks for head teachers.
Yes.
It's really important to talk about that, because otherwise we're just in the situation where we're in an echo chamber talking the same ministerial nonsense that I've been hearing this morning from Liz Truss and Boris Johnson on the Mar programme. I have
what was
not
the nonsense
met a single teacher or head teacher who doesn't want children back in school and being educated. And remember that schools have never been closed yet to all pupils. They've been looking after the keywords since last March. That's not the point. We've got to talk about the logistics. You were talking this morning about, that you actually mentioned armed forces personnel going into schools. That's never actually been a suggestion. That's just ministerial nonsense. There are 1,500 armed forces personnel for 4,500 secondary schools with 4.5 million children inside them. Do the math. It doesn't work. They're going to be at the other end of a phone giving advice to schools.
If that is the case, sir, and your maths is, it's borne out, isn't it, that they're not going to be able to see everybody all the time, then there is going to something else is going to have to be arrived at. I don't know what it is, but maybe it's a particular teacher or a number of teachers being able to do it. I don't know. But there's got to be a way of doing this that we are able to get schools open and not have them shut for the length of time they were shut last year. Thank you very much indeed for your call. Let's head over to Brighton and Councillor Hannah Clare, who is the Deputy Leader of Brighton and Hove City Council and Chair of their Children, Young People and Skills Committee. Thank you for coming on the programme this morning, Councillor. Your advice to schools is what in Brighton and Hove? Stay closed?
So we've done two things. Firstly, we've written to Gavin Williamson and asked him to include us in the contingency framework. That would mean that our schools were open on the same grounds as London and other areas of Essex, for example. We've also advised our schools that they should only be open for the next 2 weeks, our primary schools, for the next 2 weeks for vulnerable children and the children of key workers.
And why have you decided to give that advice?
We were looking at our rates and how much they're increasing. When you look at the rate by Monday, we're going to be in a very similar position to Westminster, who were closed at 500 cases per 100,000. That's where we're going to be by Monday. And we think that, therefore, if it's the right decision for places like that to close their primary schools, then it's the right decision for us.
But of course, it's not just on case rates. Sorry to interrupt, Councillor. It's not just on case rates that decisions are taken. It's taken on hospital capacity. It's taken on vulnerability of the population. There are lots of other decisions that are involved in that call. And there might be people this morning, potentially people who live in Brighton and Hove, who say, well, hang on a minute, where is the science behind your decision?
Well, our decision was made on the advice of our Director of Public Health, and it is really on that worry about how much the transmission is increasing in our city. We want to keep our community safe, and we're taking on advice from SAGE themselves, from Imperial College London, who've said that the only way to get the R rate down across England is for primary schools for a short period of time to close. That means that in future we won't have a prolonged closure, because we want to avoid a prolonged closure as much as I think the government do. And we're just taking this tough decision that the government wasn't willing to do.
The Prime Minister has addressed you this morning. I wonder if you would take a listen to this. This is Boris Johnson speaking on the BBC a little earlier.
My message to such councils is that they should be guided by the public health advice, which at the moment is that schools are safe in those areas where we're not being driven by the new variant to close them. That the priority has got to be children's education, but obviously we want to work with them. I mean, we've got to be humble. We've got to be humble in the face of the impact of this new variant of the virus. We've got to. We let's face it.
That means
we face a very, very difficult few weeks and months until the vaccine comes on stream.
That means if I ask you whether you can guarantee that schools will open on the 18th of January, you can't say yes, can you?
Well, obviously, we're going to continue to assess the impact of the Tier 4 measures, the Tier 3 measures. If you think about it, where we'd got to before Christmas, if you recall,
I'm going to come to that.
That the Tier 3 measures had actually been pretty effective in dealing with the old variant of the virus, and you remember what had happened in the northwest. There was a real progress that had been made, and then we saw this very stubborn strain this stubborn epidemic in Kent and parts of London. And people were saying, what's all that about? Are they doing things differently? Are they failing to follow the guidance? And that wasn't it.
That was the Prime Minister speaking to the BBC's Andrew Marr a little earlier, saying, Councillor, that schools are safe.
Well, we looked at our figures, and our Director of Public Health advised that we were in a position very similar to areas of London and Essex and other parts of the east of England. That's why the government have made the decision to close those schools, because they felt like those schools would be better if they were only open for a smaller number of children. We've looked at what the figures show. We've looked at the scientific advice, and we've made the call that we feel like right now we're looking ahead to areas of Kent. And if you look at the map of the southeast, it's just that dark purple is just coming over to areas like us, and therefore that was why we issued the advice to schools that we feel like for a short period of time they should close to protect them from a longer closure.
So do you think the Prime Minister is just wrong to say that schools are safe?
I think so. I think in areas like us, where we're seeing this huge increase in transmissions rates, I think he has to look at the numbers and see that the right thing to do across England is to just have this short period of time where we delay school opening, except for the most vulnerable children and children of key workers, move to remote learning so that we can protect our communities and make sure that all our communities are safe. It's not just the children themselves. It's about parents and families and staff and making sure that they're safe. And we've got such an inconsistent
Well, there are parents who are going into work, possibly at risk to themselves because everything is slightly riskier these days, who will be looking at this and thinking that you haven't taken the difficult decision, Councillor, you've taken the easy one.
I don't think so. I think it's a very difficult decision. We had to weigh up the fact that we were issuing this advice with such a short period of time and knowing that this is going to cause some challenges for parents who have to find solutions to childcare. We also know that it's difficult to go against the government when the government are issuing this advice, but we felt like it was the right thing to do for our community, and we really weighed it up, and we felt ultimately that looking at the rates we were going to have at Monday, we've had a 500% increase since the lockdown, the end of the lockdown in December. That's a huge increase. And if you told me the figures that we're looking at now and saying, is this enough, back in March, I would have said, of course that's enough, because our figures are so much higher.
Councillor, good to talk to you. Thank you for coming on the programme this morning. That's Councillor Hannah Clare, who is Deputy Leader of Brighton and Hove City Council and Chair of their Children, Young People and Skills Committee, responding to the Prime Minister's call to those councils, and there are others as well, who are advising their schools to remain shut, despite the government saying that they are safe enough to open. Have you changed plans for yours about sending them back? I mean, you must be looking at this, if you've got a school, if you're in an area where schools are open, you must be looking at this thinking, do I do it? Is it worth it? Because who knows, in the next few days, in the coming weeks, the government may well announce that many more schools around the country are going to shut, and you just end up worrying whether you've sent them into harm's way. 0345 6060 973. Come to more of your calls after this. Tom Swarbrick here, 11:33. News headlines now. Thomas Watts.
Pressure is mounting on the English and Welsh governments to keep all school children learning from home next week. Boris Johnson has insisted classrooms are safe and says parents should send their children back in areas where they're open. The head of the London Ambulance Service says crews are under sustained pressure from the spread of COVID-19. Garrett Emmerson has told Swarbrick on Sunday on LBC the service is busier than during the first wave of the pandemic. Chelsea's Premier League match against Manchester City is expected to go ahead later, despite 5 positive COVID tests in the City squad. Burnley's match with Fulham's already been called off because of several confirmed infections. And the weather, cloudy in England, Wales and eastern Scotland, rain across coastal counties in the northeast with wintry showers further inland, brighter spells in the west, a high of 5 Celsius.
This is LBC. Swarbrick on Sunday with Tom Swarbrick on LBC. Call 0345 6060 973.
Sandra, we'll come to your call in just a few moments' time. Let's speak to Wendy Simon on the programme this morning, who is the acting mayor of Liverpool. Thank you very much for joining us this morning, Wendy. What is the view of the leadership in Liverpool about the opening of your schools?
I think we're still in negotiations with the trade unions, the head teachers, etc. in respect of Liverpool. We're in Tier 3 at the moment, and obviously our rates are a lot lower than they are in other parts of the country, but obviously they have trebled in the last couple of weeks. So we know, people are meeting at the moment. So we've heard what the government have said this morning, clearly about primary schools in particular. But we're looking in working with those head teachers, with the trade unions and stuff, to support them in the best way we can as a local authority.
And so given that tripling, which is, astonishingly fast, that tripling in cases in Liverpool, what is it that you want the government nationally to do in order to protect the NHS?
I mean, what we feel needs to be happened, and that's based on our experience of what's happened so far, is that there does need to be a national lockdown, that we have to work that alongside the mass testing programme that we already have in the city, and that has been working well. And with those two things, also add to that mass vaccination programme. We've got the 2 vaccinations now that are on offer, and we feel if that could be given to the city to roll out, that we could do that very quickly and in a much more effective way to get those vaccinations out.
Just to test, though, that idea of locking down again. That's okay. Just to test the idea of locking down again, though, nationally. The health service in Liverpool, as far as I understand it, is obviously under pressure, as they all are, but is coping. The numbers have tripled, but there's a lot of very good mass testing that has been available to Liverpool in order to find where the virus is. So in that regard, there isn't much left to close, to be honest, Wendy. Is a national lockdown only halting what is the inevitability of the virus popping back up anyway?
We don't believe that. We think if things are left, it's inevitable there will be a lockdown at some point. And what we're trying to do is actually react rather than at crisis point, so that actually we can bring those numbers down further, that we don't put that strain on our hospitals. As you said, yes, they are under pressure, but they're not at crisis point in Liverpool at the moment, and we don't want them to be at crisis point. We want everybody who accesses the health service to get a good service, and certainly we feel that doing that now is actually going to be proactive, be able to get that mass testing to continue, and also the vaccination programme up and running.
And length of lockdown? I mean, is it a month? Is it 2 months? Is it until enough people in Liverpool are vaccinated? What are we talking about?
I mean, I think it's difficult to give a definitive, 2 weeks, 3 weeks at this point in time. I think what we would say is, a shorter time as possible. We'd really want to see those numbers. And that's why we think the tier system isn't particularly working at the moment, because people can travel between tiers. And that's what's difficult, particularly with this strain of the virus that is escalating a lot quicker than the previous strain.
Well, there are some people who say, well, let's put in roadblocks. Let's put in roadblocks. Let's stop people moving around different areas. I mean, it feels almost impossible to actually implement, but nevertheless, that's what people are suggesting.
I mean,
as a
some people
remedy.
are saying that, but then it's said that you can travel for work or to trade. So it's very difficult to do those things. And as we've said, if we have that, sort of national lockdown where we can really get on top of this alongside the vaccinations. We've got 2 vaccinations now. This is really new. We could really concentrate on that going into the spring, and actually make sure in the long term that we do get that recovery for our cities and towns right across the country. I think it does need to be a national approach now.
Simon, thank you very much indeed for your time. Wendy Simon, you're the acting mayor of Liverpool. I think if you haven't come to the conclusion already after months and months of this, certainly listening to Wendy and to others, there are no good decisions here, are there? There are only bad calls. Sandra's been waiting patiently in Shepperton. Hi there, Sandra.
Oh, hi there. Hi.
Hi.
Yeah, I wanted to just
highlight the plight, really, of the TAs, the teaching assistants, who will be coming into the schools tomorrow to support all the vulnerable and special needs students, unlike many of the teachers who will be at home doing, online work from home. And obviously, many of the TAs are older, in their 50s or 60s, and many are coming probably in, obviously I should only be speaking about my school, but do come in on public transport. And, we've been doing this since March, from the very first, lockdown. And I think, people need to know out there that we're doing our best, we're trying hard, but we are I feel that we're being put at risk and sometimes not treated as fairly as we should be.
Well, I think, Sandra, teachers and teaching assistants, as you rightly point out, they are almost the sort of unsung heroes of a lot of this, because as you say, people have been going in day after day after day after day at an increased level of risk to themselves. But I think we've still got to remind ourselves sometimes that the risks of catching this thing and falling very seriously ill to the point where you need hospitalisation, they're still incredibly low.
I agree. I think it's some sort of, it's the sometimes unfairness, that I feel that we have to go in. The teachers volunteer to go in. There's the teachers, I feel, should be taking part of some of that teaching in the schools of the special needs students and vulnerable students in school alongside us, so that, like in March, April, May, June, it was just us and one senior member of staff, one teacher, and it was down to us. And I'm hoping that this time round, there are more teachers who are going to come in and support us in supporting Sandra, the students.
I think as much support as can be given to those kids who absolutely need it, particularly the vulnerable ones, then the better. Thank you for what you do. Thank you for your call. Want to squeeze in Anna, who's a new caller to the programme in Peterborough. Hi there, Anna.
Hi, Nick. Hi, Tom.
Nick will do. Hi, Anna.
Hiya. I was just going to talk about the schools and everything going on at the moment. As a new mum and everything going on, my children are in a village school, and it's hard for them, even if they're at home or if they are going to be closed and everything like that, to find resources for them. And teachers are working very hard, but as a smaller school, it's hard for them to get resources for them to have a full education.
Mm-hmm. How old are your children, Anna?
They're 3.
They're both. So you got twins.
So I've got a 3-year-old and I've got a 5-year-old.
Okay. So one's going into. And your school in Peterborough is open for the 5-year-old. And is the 3-year-old in nursery?
He's in nursery, in the village.
Yeah. And are you happy about sending him in? Because one of the things I haven't quite got my head around yet is why is the cut-off at 4 for shutting primary schools, and yet nurseries are still open even in tier 4 areas?
Yeah, absolutely. So I don't know, really. As the kids are small and social distancing and everything they're going on, they're not going to really understand everything like that. And, I want to get them, even as they're young, getting, writing their name, everything like that, so that as they're older, they can develop these skills for, adult ages and everything like that.
Yeah. No, I think, Anna, you're absolutely right. And I think it is sometimes... Well, I think it's the case anyway, as the son of 2 teachers, as the husband of a former teacher, that first year of school is absolutely critical to get kids to, one, enjoy it, but also to start learning those absolutely critical skills. It is really, really fundamental to their school life. And for a lot of children, that first year of school has been completely blown apart by all of this, understandably to a point. But there will come a point where I think a lot of parents will say, that will worry massively about whether their child is falling behind too far with the education that they should be getting. 0345 6060 973 is my number. I want to talk about the vaccine rollout after 12. We'll speak to a professor who's able to answer some of your questions about the rollout of the vaccine, given that the strategy has shifted. We'll speak to Professor Sir David Spiegelhalter in a few moments' time on that. Tom Swarbrick here, 11:47.
Nick Ferrari at breakfast, LBC.
This is not what policing is about. I don't want people to be frightened of you, but they have to respect you, like the strict teacher when he walked into the class, or she walked into the classroom. Now the police rock up, people just laugh. This is what happens when a police force becomes politicised. Whether it's wearing high heel shoes in Cardiff to show your support for an anti-slavery protest, and the latest absurdity is posing with a poster supporting Gypsy and Roma travellers. That's not what you're there to do.
Nick Ferrari at breakfast. Weekday mornings from 7. LBC. This is LBC, Swarbrick on Sunday, with Tom Swarbrick, live from Westminster. Call 0345 6060 973. Tweet at LBC. Text 84850.
Terry and Cobham, you're going to be next on the radio to talk about the schools, but after the news at 12, I want to talk about the vaccine rollout, given that that is the way out of all of this, God willing, that we can get it to as many people as possible and then we can start getting back on with our lives. I'm joined by Professor Sir David Spiegelhauter, who is a statistician and chair of the Winton Centre for Risk and Evidence Communication at the University of Cambridge. Thank you very much for joining the programme again, Professor. The vaccine strategy has changed in relatively quick order to now start giving the first dose to as many people as possible. Statistically, is that the right thing to do?
I actually believe it is. I was a bit surprised at first because this is not what happened in the clinical trials or whatever, but JCVI, the body that makes the recommendations, were clear that they often make recommendations about vaccines that don't fit exactly how the experiments were done. And they've worked out, I think very reasonably, that if you're going to save the maximum number of deaths and hospitalizations, it's best to get a first shot into as many people as possible and then leave the second shot up to 3 months after that one.
Yeah, and in terms of managing the risk then to the wider population from those people who have not been vaccinated, there's been a bit of a discussion about whether or not teachers should be higher up in being able to get them. Potentially, with an awful trade-off between those who are most at risk versus teachers who are critical to society. What say you about that decision?
Oh, that's very difficult indeed, because I was a big supporter of the JCVI prioritisation, which is a really evidence-based, risk-based approach, largely involving age, but also including healthcare workers and people with other conditions. And so their prioritisation into groups seemed quite reasonable, but teachers were not included as one of those prioritised groups. I can see the arguments for that, although, as far as I know, the evidence is that teachers themselves have not been at substantial risk of harm from COVID. Again, it's the risk in schools, which I'm sure you were talking about all the time, is not actually to the kids themselves or even particularly to the teachers. It's to the general community in terms of transmission.
People are obviously, understandably and rightly, quite worried about what's been going on and what continues to go on, particularly with this new variant. But give us some context around the chances of getting this and becoming very ill and worst, of dying from this.
Well, I think, we've known for some time the obviously average risk, if you catch it, of dying is about 1 in 100. Now, that's dropped. That was roughly what it was in the first wave. It looks like it's gone down to about 0.7%. It dropped down about 40% now, which is great because of the improvements in treatment that have been learned. Now, but that average, actually, it's one of these hopeless averages because it represents almost nobody. In fact, it represents roughly me, about my age, mid-60s, just about that age. So that's about my risk if I get it. But almost nobody has that risk. You've either got a much lower risk if you're younger or a much higher risk if you're older. But it does mean that very roughly we can do some sort of sums. I got a really rough rule of thumb that if you smooth the number of reported cases each day, very roughly divided by 50 or so, you kind of get the number of deaths there might be in about 3 weeks' time. So that's not supposed to be precise, but it does give an idea of the inevitability of what happens now influencing what's going to happen in the future.
And are we seeing a change then in trends when it comes to death?
Wow, it's very interesting. Well, again, deaths just follows what happens in cases and hospitalisation. So deaths are increasing slowly now, which reflects the increase in cases following the November lockdown. And so we're just following that inevitable trajectory. Now, what's going to happen to those depends on in the end of the month. So it depends on what's happening now. And there are some very interesting trends at the moment. I think the first thing is not take too much notice of the numbers being reported each day on the news, because those are reports which may go back days and days. What happened over Christmas, over the last 10 days, is very interesting. Broadly speaking, in London and in the UK as a whole, the number of cases have been broadly stable, except for a massive spike on the 29th of December, 4 days after Christmas. A huge burst. Nearly doubling the number of positive cases, well, at least 50% extra on the doubling on the number of cases of people who went for a test on the Tuesday after the Boxing Day bank holiday, the delayed bank holiday. Huge burst then. But apart from that big spike, it's broadly stable. Now, that's not great, and the number of people in hospital is broadly stable as well. Now, the crucial thing is what happens in the next few days is absolutely vital. Is this going to start dropping? Is it going to stay where it is? But whatever happens, we know, because of the delays built in, that this is going to be a really tough January and February for the NHS. And that means that essentially normal service, as we're hearing again and again, is not really going to be feasible.
But if we see, Professor, I wonder whether there's a small glimmer of hope in this, that if we see over the next few days those cases either flatlining or starting to tail off, perhaps, then maybe it's an indication that the Tier 4 measures are to an extent working, and perhaps then schools could remain open.
I don't like talking about what should happen. I just want to look at the figures. At the moment, it's really hovering. This is an absolutely crucial time. I'm looking, every 4 o'clock every afternoon, you just look at the data with enormous interest, because, as you said, even if they stay stable, that at least means the NHS might be able to cope. And if they start going down, that's fine. Deaths then follow substantially later. And in fact, it's the hospitalizations which are the crucial statistic, because it's the ability of the NHS to cope. Deaths are important, of course, but they have gone down as a proportion of the people with the cases. And also, the other flicker of good news is that deaths from non-COVID causes are much lower than normal. They're actually operating at a very low level at the moment.
Well, we'll take all the good news we can get our hands on at the moment. Professor, great to talk to you. Thank you very much indeed for your time. Professor Sir David Spiegelhalter, statistician, chair of the Winton Centre for Risk and Evidence Communication at the University of Cambridge. Great pleasure to have you on. Thank you very much indeed. Terry has been waiting again very patiently in Cobham. Terry, good morning.
Oh, it's still good morning. Hello, good morning, Tom. I agree with the professor. You shouldn't listen to the news or believe anything on the news. There is vaccine. No, not all about LBC. You get straighter news from LBC than you get from anybody else. But
Thank you, Terry.
I wouldn't agree about the figures or the vaccines or anything. But I'll just give you an instance.
You wouldn't agree with the
If
vaccines?
someone could answer this simple query. My daughter is a head teacher in a London borough, Kingston. And that was one of the boroughs that was not going to close the schools until the change of decision. I believe that was on Friday evening or Friday afternoon. So that was changed. Would you, Tom, I know you're going to say no, so stop asking the question, would you want to walk into a school full of 324 children who carry this disease? And they do carry it. No one's told me that. I'm a father of 6 children. I know that children carry diseases. They're born with 6 viruses up their nose that would kill an adult if you had them in your adult
listen, Terry,
team.
I think in answer to your question, I'm absolutely delighted not to be a teacher, because I'd have to weigh up the answer to that, and I wouldn't be. I have to say, as long as there was, as long as there was that I had the ability to be tested very regularly, and I'm meaning sort of every day or every other day, then I'd feel a bit better about it. But you are at an increased risk, of course you are.
Right, Tom. Right, she's got 364 children, and there's classrooms, say, approximately 30 children. I wouldn't want to walk into that. Now, she was worried before that on Friday, but she copes the job. She worked throughout lockdown since March, every day, vulnerable children, delivering school meals and everything. So she's worked a lot, and she will work tomorrow. But please answer this. Just answer this one question: How come that they have not taken every teacher and given them a vaccination?
Well, do you know what, Terry? You ask a question that I'm going to be seeking an answer to from a variety of people, and indeed, I will use your question as the first one put to Professor Beate Kampmann, the director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine, who's going to join us after the midday news, because there are questions now about whether not just the most vulnerable, the most critically vulnerable to this start getting the vaccine, but whether in order to get a degree of normality back into our lives, we start vaccinating those in critical professions like teachers, whether they could be bumped to the top of the vaccine list as is being done in Israel. We'll put that question first to our guest after the news at midday.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at midday, Boris Johnson's insisted he has no doubt schools are safe and parents should send primary-aged children back this week. The Prime Minister's rejected calls for closures in London to tackle the spread of the new variant of COVID-19 to be extended across England. He's also warned coronavirus rules are probably about to get tougher. Labour's Shadow Schools Minister Wes Streeting says it's inevitable that will involve lessons moving online.
Where we are today with schools is a reflection of the fact that the government has lost control of the virus. It didn't need to be this way. On the public health front, we've learned time and again that when government dithers and delays and is too slow to act, that shores up bigger problems.
Hundreds of new coronavirus vaccination centres are preparing to open across the UK from tomorrow. Around 500,000 doses of the newly approved Oxford AstraZeneca jab have begun arriving at hospitals and GP-led facilities. It's hoped the programme will eventually reduce pressure on NHS services. Dr Duncan Robertson, an analytics academic at Loughborough University, has told LBC all regions are seeing more intensive care patients.
And the average age is around 60. But I think what's even more surprising is that a quarter are 52 years or under. So it's just not old people, of course, who are getting it. It's a disease of younger people as well.
A 16-year-old boy and a 28-year-old man have been charged with the murder of an 83-year-old in Essex. Donald Ralph was found dead at his home in Oldham, near Colchester, on Tuesday. Authorities in India have approved the emergency use of 2 coronavirus vaccines. It paves the way for the start of a mass inoculation programme using jabs from AstraZeneca and the Indian drug maker Bharat Biotech. The country's planning to vaccinate around 300 million people on a priority list this year. Manchester City's Benjamin Mendy is reported to have broken COVID rules by hosting a New Year's Eve party. That's despite a COVID-19 outbreak at the Defenders Club, which forced their recent Premier League match with Everton to be postponed. Today's game between Burnley and Fulham has also been called off because of a number of infections. And the weather, rather cloudy in England, Wales and eastern Scotland. Rain across coastal counties in the northeast with wintry showers inland. Brighter spells in the west, a high of 5 Celsius. From Global's newsroom, I'm Thomas Watt.
is LBC from Global, leading Britain's conversation. Swarbrick on Sunday with Tom Swarbrick on LBC.
Very good afternoon to you. 3 minutes past 12 is the time. You're listening to Swarbrick on Sunday here on LBC. I'm Tom Swarbrick. I hope we find you extremely well this Sunday afternoon as we all gear up to go back to whatever's left that's open on Monday morning. And I don't know about you, but over the course of the last week or so, I've been studiously avoiding much of what's been going on in order to try and keep, a level head during all of it, because it's been an incredibly busy Christmas period. Not just, of course, because of the spread of coronavirus and everything that's associated with that, but you may have forgotten that we've left the European Union, or we did once that Brexit trade deal was signed, and then we got it over the line on New Year's Eve. So we'll speak to David Davis, former Brexit Secretary, in about half an hour or so to talk about the impact not just for the country on what it should do next in order to perhaps take advantage of whatever the benefits may be, but also for the impact on the Conservative Party and Boris Johnson as well. There's some interesting polling out today which suggests that were there a general election in the coming days, Boris Johnson would lose his majority. So we'll talk to David Davis about that in half an hour. But don't know about you, but I have a lot of questions about the vaccine rollout. And in picking up where my cheese-addled brain left off before Christmas, it strikes me that the government strategy on vaccines has shifted in the way in which Tony Blair suggested it might do a bit before Christmas, in saying, well, why are we waiting to give people the second dose before giving many others the first? Let's get all the doses out the door and get them into the arms of the people who need them the most. The government is now saying it is going to do that. The Mail on Sunday carrying the words of Professor Jonathan Van Tan, the Deputy Chief Medical Officer, saying waiting 12 weeks between jabs rather than the original 3 will protect those most at risk of dying from COVID-19. So if you've had your first jab, rather than waiting 3 weeks for the next one, you're now going to have to wait 12 as more and more people take those jabs and get them vaccinated. Whether or not it means that professions could be boosted up the list, so it's not just those who are clinically vulnerable, but those who help supply normality, whether it's teachers, whether it's, certainly key workers in hospitals, whether they can be bumped up the list, and how this is going to be delivered. Because there's already whispers about global vaccine shortages. There's concern about the vaccine supply chain into this country. And you look at other countries around the world where they have done this very, very swiftly. Israel is the country that has vaccinated a greatest proportion of its people in a very short space of time. How have they done it? And could we see some of what they have done happen in this country as well? So any questions you have, 0345 6060 973 is the number. You can put them to Professor Beate Kampmann, who is Director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine. She's also Professor of Paediatric Infection, Immunity and International Child Health at that same institution. Great to have you on the programme. Thank you very much for being there for us this afternoon, Professor. Let's start with the slight shift in strategy. What do you think has brought that about?
Yeah, so it's a really important change to what was originally anticipated. And the reason is trying to weigh up how much more quickly we can protect more people as opposed to protecting fewer people more comprehensively. And I think the first thing that needs to be said is that everybody will need their second dose. And we shouldn't assume that one dose is going to be enough, and nobody will underwrite that, because we're absolutely certain that the immune system will need the 2 doses, because the trials have shown that. So for the AstraZeneca vaccine, there are some data that if you delay the second dose to 12 weeks, it doesn't actually make a difference to your immune response. Therefore, given that that's probably the vaccine that's going to be rolled out most in the UK, that's probably okay. For the Pfizer vaccine, there are no such data, and the company is not too happy about this approach. And us as vaccine experts might not be too happy about it either.
And it's worth saying that the AstraZeneca vaccine is rolled out from tomorrow. So we're already seeing the delivery of the the vaccine, and it is going to be rolled out in this country from tomorrow. Is there a problem with getting enough vaccine into the country to begin to roll it out to as many people that need it? I don't know if
Sorry, I've got some interrupt.
Sorry, Professor. Sorry, that was just a question about the supply of the vaccine, about whether we're going to be able to get enough of it into the country in order to vaccinate as many people as possible.
Sure. So I believe that we're getting around to 500,000 doses of the AstraZeneca vaccine, which appear to have arrived in various parts of the country. We're aiming for a vaccination rollout that should cover up to 2 million people per week. Now, that is a lot of vaccine to get into the country. And if you give me 2 seconds to reflect on how actually the vaccines come off the production line, because it's not like you call your Amazon account and they will just miraculously appear. Every single batch has to be very, very carefully quality controlled, because we're not dealing, with some odd piece of clothing here. We're dealing with a healthcare product, and we have regulations in place that make sure that those products are consistent and that their quality is absolutely assured, because we're going to inject that product into people. So the steps that have to be taken for the quality control are absolutely vital. And it comes off the production line, and then every single batch needs to be quality controlled, needs to be signed off as quality controlled by the MHRA. So they remain extremely busy, and then has to be shipped out in the logistics of getting them to various parts in the country. So just to make people aware, it's not just, what is ordered is the same of what we can have in our fridges and freezer, let alone in someone's arm. However, we really need to know how many doses are arriving when, and what is the strategy to get the 2 million doses per week to the people. And I think that's really important. And the Prime Minister was pressed on that at the Andrew Marr show this morning, in fact.
And are you satisfied with the answers that you have heard about how that's going to be delivered, that we will be able to return to some degree of normality by the spring?
Right. Well, that really depends on the supplies, and it will depend on the vaccine entering the country and the distribution system very, very swiftly. And to be honest, I can't put my hand in the fire for that because, I've been vaccinating at our healthcare trust, my colleagues, over the last few days, and we have vaccine, but I don't know in detail when the next batch will come. And I'm sure many GPs up and down the country will be in a similar situation.
Let's get to calls, because I know a lot of people have a lot of questions about this, particularly as they're perhaps just picking it up after a Christmas break. So let's start with Tom, new caller to the programme in Hampstead. Hello, Tom.
Hello. Given that leading virologists on the internet claim that the Pfizer vaccine on the first jab only gives 50% efficacy, is it wise to therefore delay this for the most vulnerable groups, the key workers, the elderly care homes, etc., etc.? Is it wise to delay this when the virus is at its most virulent?
Professor.
Yeah, so it's a really important question. Let me first comment on what you quote as the 50 or 54%. So that is a calculation that comes from taking into account all the numbers of people in the trial that had over 40,000 people in it who got coronavirus infection during the space of the trial. Now, if you look at the people who got the infection in that whole period of the 21 days, there were actually quite a number who got it very, very quickly. And that is at a time when there would have not yet been any protection from the vaccine that they were given. So if you take those out, the efficacy of the first dose is actually quite a bit higher. How high exactly? I think people are saying up to 90%. I think it's probably less than that. But I am with you on the argument that I would have rather seen the Pfizer vaccine being administered in the protocol that has been approved by the clinical trials rather than having that delayed.
The chief medical officers all signed a letter the other day suggesting that there was 70% protection from one dose. And I haven't seen, obviously, who am I to see the evidence for that? I'm not a scientist, so I wouldn't, even if it smacked me in the face, I probably wouldn't notice it. But are you satisfied, Professor, that this is right?
What matters to me here is the information that we have from the publications and also from the company. And the fact that the company isn't too happy about it makes me feel that really we would have been better off sticking to the protocol that has actually been approved and is part of the schedule. But 70% is roughly what we have with the AstraZeneca vaccine after one dose as well. And, you can ask yourself, will you rather have 70% to some people or no protection to a large number? And this is the toss-up between the public health interest and the personal responses. But you're absolutely right. We need to check this out.
Tom, as we said earlier, there are no good decisions here. Thank you for the call. Let's go to Joy, who is a new caller in Hove. Hi there, Joy.
Hi, Tom. Hi, Professor.
Hi.
Hi, I wanted to ask about the issue concerning the misinformation surrounding these vaccines. And I think the vaccine, to me, is our way out of this, and we need to get it right, and we need to get the uptake as optimal as it possibly can be. And I think, the fact that we're even debating the kind of efficacy of it and the percentages doesn't do anything for the public's confidence on the whole. So how on earth do we combat the amount of misinformation out there? That's what I'm kind of really concerned about.
I agree with you about being concerned about. There's been, I don't know about you, Professor, but maybe it's just re-engaging with it after Christmas. The amount of just info from apparently nowhere that has popped up over the last few days about the vaccine is mind-boggling.
Yeah, I agree with you. And I think the communication strategy by the government and associated people there hasn't been optimal. And I think the fact that the data were not sort of made very easily accessible to people hasn't helped the matter. And I think we now really, really need to ramp up the confidence in that the process is being handled, with scientific evidence rather than what people might say here and there.
But with Joy's point about talking about the potential amount of protection you could get, I don't know about other people listening, but I find the idea of 70% protection from one dose quite reassuring, to be honest with you.
No, you're absolutely right. And, when we had Novak, let's just take a step back. We have 2 vaccines that are licensed and available in the UK, and that is due to the scientific progress that has been made around the world and the rigorous science that has led us to this point. So that's really good. And we were able to get to vaccines that have much more than 50% protective efficacy, which is great because we were quite happy to accept 50%. So let's just stick to that. So I think there is good evidence that the vaccines we have are safe and effective. And that's the message we really need to give people now. Yeah. And we need to reassure them that the supply situation is in hand. And I haven't yet seen that reassurance, unfortunately.
Well, I do want to. We'll come back in a few moments' time, and there are loads more questions for you, Professor, as you might well imagine. But I'm very, very keen to find out how this is going to work, or what you expect to happen in delivering the 2 million doses that the government now says it wants to deliver. Whether that is possible, how that is going to be done, or whether this, I'm afraid, might be another case of the government setting expectations incredibly high and not quite being able to deliver. Professor Beate Kampmann joins us until 12:30. I think you kindly agreed to, Professor, Director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine. Get your calls in while you can. 0345 6060 973 is the number. Tom Swarbrick here, 12:15.
This is LBC. This is LBC, Swarbrick on Sunday, with Tom Swarbrick, live from Westminster.
12:18 is the time. We have the new second vaccine out from tomorrow. More people are going to be inoculated with it over the course of the next few weeks. The government is very clear that it wants to ramp up vaccination massively to the point where they're delivering 2 million doses a week. I'm joined by Professor Beate Kampmann, who's here to explain whether or not that is going to be possible, and lots of you piling in with your questions as well. So let's come to Simon in Orpington. Hiya, Simon. Happy New Year.
Hi, yeah, and to you, Tom. Thanks for taking the call. My question is, at the press briefing the other day, the government advisor said it was unlicensed vaccine. So I just wondered, in layman's terms, what unlicensed means. And also, they're not sure about how it affects fertility at the moment. So when will they find that out? And for those people who still want to have children, when should they make the decision whether to take the vaccine or not?
Professor.
Yeah, okay, so the vaccine is approved. We're not using any unlicensed product. So this is, it has to do with the way that full licensure is given versus emergency authority approval. And what we have at the moment are two vaccines that have received emergency approval in the UK, but also in some other countries. So we're not on their own with this. They've been found to be safe and effective, so they've qualified for all of this. So you can trust that these vaccines are up to the job that they're meant to be doing. So you're now asking about the context of giving these vaccines during pregnancy or when you're expecting to conceive. And actually, the advice on that has changed. It was initially not advised because they were taking a really, really cautious approach, because we don't have many data of the vaccines being used in pregnant women because they were excluded from the clinical trials. So when the regulation came through in the US, they gave approval for the vaccine also to be used in pregnancy, and that there wasn't any biological reason to think that they should have any side effects for people who want to conceive. And there isn't a biological reason. So now the regulation in the UK is also approved that if the risk of the pregnant woman is significant, that we would recommend giving the vaccine, and we would want to do that and recommend it. And I don't think there's any consideration or worries about getting pregnant either.
Simon, I hope that is helpful. Thank you very much indeed. Ruth is a new caller in Bristol this afternoon. Hi there, Ruth.
Hello.
Hi.
Thanks
You're on
for
with the
talking
Professor.
to me.
Yes.
Can I ask, I'm an 8-stone woman, so why do I have the same dose as a very fat man? He obviously has a lot more blood and more cells than I do.
Not necessarily, actually, Ruth. The distribution of mils per kilo of body weight is very, very similar. And the immune cells that are around your body are not that different from someone with a much higher body mass index. So, the people who are enrolled in the trials actually represent a wide spectrum of BMIs, a wide spectrum of ages, a wide spectrum of ethnicities. And this is the dose that's worked for literally everyone. So you can be reassured that the dose that you're getting is a dose that will work for you as well as for your neighbour or someone down the road.
That's a very good point, actually. I hadn't thought about that, but it's a helpful answer. Just one from me before we go to David in Enfield, Professor, is on the how of this. You might have seen the front page of the Sunday Times today talking about a postcode lottery for the life-saving jab. Patchwork rollout casts doubt on minister's claim to vaccinate 2 million a week, that there aren't enough centres to get vaccination to people, and there are some that are going to have to drive maybe 20-mile round trip to get to these places. What can be done to deal with that? Do you think we're going to need, pubs to open to be able to vaccinate in, or local village centres or churches, wherever? It doesn't matter. Just have somewhere that's set up for people to come to get jabbed.
Yeah. Absolutely. So the first thing is to create an environment that is suitable for the vaccinations. You need to have the personnel to be delivering the vaccine safely. And if anyone has an allergic reaction, it happens very rarely, but it can happen, that you have a way of looking after people. You need to sit them somewhere after they've had their jab for 15 minutes to make sure everybody's cool. So you can't do it in the post office. Let's put it like that, right? But I know Brewdog, for example, have already volunteered their pubs for doing this. So it's a question of getting the personnel rolled out, and it would be a real shame if it was a postcode lottery. We can't afford that. And ultimately, we need significant coverage across the country, and GPs and pharmacies will be playing a key role. And with the vaccine that can be kept in the fridge as opposed to in the freezer, this will be much easier to organize than with a vaccine that needs a pharmacist to dilute it. So I have confidence that the rollout will be much facilitated by this new product that is being made available now. How quickly?
But in your understanding, sorry to interrupt. In your understanding of the supply chains and how this is going to work, we're going to have to increase that number enormously in order to get 2 million doses a week, right?
Yeah, we need to go 8 times as fast as we've gone in the last couple of weeks. That's roughly the equation. So, but the fact that we can now not just give the vaccine from hospitals, we can give it from GP practices, we can take it to old folks' homes, etc. That makes a huge difference. And now it's really all hands on deck.
And finally, just from me on this, when it comes to the numbers of vaccines actually available, so if we've got over 500,000 of the Oxford AstraZeneca coming online tomorrow, I note that actually whilst we've been on air, India has given emergency approval to the AstraZeneca vaccine and has already made around 50 million doses and expects that to double soon. How is it that India has been able to make so many so quickly?
Yeah, so India has an extremely productive vaccine industry. There's a Serum Institute in India, there's Bharat, and actually amongst them, they produce about 2/3 of the vaccines we're currently using internationally, particularly in developing countries. So they've revved up this very quickly. They had a large commitment already manifested around it about 6 months ago, and as soon as it's been approved, they've ramped this up massively. And obviously, they have a huge population to cater for as well.
And we don't have that industry. We don't have the ability to do that as quickly.
Well, you're touching on a very, very sensitive point here, because the vaccine manufacturing capabilities in the UK are not sufficient, and we rely on vaccines coming in from other sites like Belgium, Europe, various other countries.
Not?
Why not? Because there haven't been investment into these areas in due time.
And is that's just been the case for generations, has it, or did investment stop, or?
Yeah, I mean, the vaccine industry basically moved out of the UK over the last 20 years or so, and we're now suffering from the lack of investment. And the government has been trying to catch up with this to some degree. But again, a vaccine factory doesn't come out of the woodworks just like that. It's not like you don't go to IKEA to get yourself a vaccine factory.
Yeah. I would love to know. I'll go back and check what it was that Exercise Cygnus, the pandemic preparedness exercise that was undertaken in 2016, had to say about the vaccines industry in this country and whether or not there was enough of it. Enough from me. David's in Enfield, been waiting patiently. David, your question.
Yes, good morning. 2-point question. If you've already had COVID, you've developed antibodies in your blood to the virus, should you be getting the vaccine as a priority in view of the scarcity of supply? And secondly, if you don't take the vaccine, what are the chances you've been reinfected by the virus within a reasonable time period?
Yeah, both very important questions. So we do not conduct any tests to see if someone already has antibody or not. And we've included people in the trials who already had COVID. We don't know how long the antibody lasts. We don't know how much of it you will definitely need to prevent infection. So if you're offered the vaccine, take it. The second question was around how do we, sorry, just repeat what was your second aspect there?
About whether or not you could be reinfected.
Oh, yeah, whether you could be reinfected. So in theory, yes, you can be reinfected. There are some examples of people now who have been reinfected, although given the amount of virus that's going around, we don't think that this is a major issue. It might depend when you had the first infection, because your antibody might still be there or might not be there. Some people who had definite COVID never made the antibody. So that's why it's important to get the vaccine when you're offered.
David, thank you. John's in Croydon. Hi there, John.
Good afternoon. Yes, I've had the pneumonia vaccination. I understand that pneumonia is one of the major killers of COVID. If I am unfortunate enough to catch COVID, will the pneumonia vaccine assist me in fighting it off?
Yeah, so the pneumonia vaccine you had was against a bacterial infection, which is called pneumococcus, and it's a really important vaccine, especially for people with lung issues and who are a bit elderly. But it's totally different from the vaccine and from the disease that is caused by the COVID virus. So if you are offered, you won't have protection against the COVID virus from the pneumonia vaccine you've already had. So if you're offered the COVID vaccine, please have it.
Sorry, John. Mo's in North Finchley. Hi, Mo.
Good morning.
Good morning.
Good morning. 9 months. I've been in the house 9 months.
waiting for a jab. I had the jab last week, the first jab, and now I'm not going to get the second one. I understand from a cousin in America that they're all having the second one. Nobody's having one. She said what we've had is useless. The Germans are also giving the second jab. So they're saying we're not, she said, you're not protected, you better stay in for another 9 months. So I would like to hear what this doctor's got to say, because I don't actually think they've got the second jab, because everyone is avoiding it. And also the other thing too is we cannot now have the Oxford jab because we've had the American jab.
Yeah, so you definitely still due your second jab. It doesn't mean that you are not going to get it. It's just the interval has been changed. And I think people really need to think about that very carefully, because especially the vulnerable people, I'll be much more happy if you had your second jab when you were due it. And it has caused a lot of confusion with the GPs as well, who'd already scheduled all of these appointments. And we need the GPs to help us with the rollout. So I think we need to, we need to push back maybe on this decision. I don't know how successful that will be, but for the Pfizer vaccine, I believe, in my opinion, that we should all be getting the second jab as it was anticipated, and especially for vulnerable people like you.
Yeah, Mo, I just wonder if how you feel about not getting the second jab when you anticipated getting the second jab.
I've been after sitting in for 9 months. I thought we were at least going to be able to go out, but we can't really go out, according to my American cousin.
Yeah, but hang on, Mo. It's not going to be 9 months. It's going to be, because you're going to get the second jab, and we're talking 2 months longer, possibly. You might be able to get it earlier, as soon as they're offered.
I'm due to have it on the 20th of January. I was due, but I presume that's cancelled now.
Yeah, but you will get it within at least the next 4 to 6 or 8 weeks after that. So it's not like you're not going to be protected finally by this vaccine. So it's not been a waste of time. You will get the second jab, and then within, you're already probably about 70% protected. But the instructions are to keep on being very careful, shield, get the second jab, and only then are you properly protected.
But and what's interesting, Mo, and I'm really glad you rang, because you are exactly the kind of person that a lot of people feel have been let down by this change in strategy that happened over the last week or so, that even though it sounds, I think, like a good idea to get as many people vaccinated or get as much protection to as many people as possible, it does mean that people like yourself, Mo, who were expecting to be fully protected against this in the coming weeks, you're now not going to be. Do you see the sense of the change in strategy that the government has chosen to do, Mo?
Something that is frightening. I think the numbers have been frightened of people who are getting the new one, so they're taking that away because they want to have equalised, which is fair in some ways, but unfair to those people who've been sitting in the house for 9 months or 12 months thinking they had hope. There was a queue for 25 people when I went for my jab. I haven't been out of the house for 9 months, and yet after 25 minutes I felt safe all of a sudden. And all of a sudden now I'm not safe anymore. I have to say I'm an elderly woman, obviously, because otherwise I wouldn't have been in the queue. But there were people there that hadn't got appointments. And they got jabs at the same time.
Well,
so I think possibly it needs to be looked at a little bit more carefully on that line. But having said that, we have no satisfaction at all as old people. We're just left. And I have at least a dozen friends who are in the same situation. And we're really despairing because we don't know what's going to happen next. I mean, can we go out or can't we go out? I have a letter every month from Matt and his colleague telling me don't go this and don't do this. And I haven't done it. I've done exactly what they told me to do.
Well, listen, Mo, I take my hat off to you for having shown the forbearance to deal with the 9 months of being inside. And it's the hope that there's going to, you were going to be able to get out much quicker than you currently are, because I suspect, Professor, the advice would be to Mo and to others who have seen that date pushed back, that they're going to have to spend a bit more time inside.
That's right. Yeah, they basically have to continue doing what they're doing. But you have had, you are currently producing some protection, but it's not absolute. And therefore, it's in everybody's best interest if you continue what you've been doing until you've had the second jab, and even then a couple of weeks later still.
Mo, I'm so sorry. Keep going. It will happen. We will get there. Professor, thank you so much for your time. It's been really helpful, really instructive. Professor Beate Kampmann, who is Director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine, Professor of Paediatric Infection, Immunity and International Child Health there as well. Thank you very much indeed. It's been very helpful. 0345 6060 973 is my number to continue on about whether you think this change in vaccine strategy is the right thing to do, despite, Mo's obvious sadness at seeing her freedom, pushed back a bit more. And we'll talk in a few moments too to David Davis, the former Brexit Secretary, about what the UK is going to do with any newfound freedom that it might have now we are outside the European Union. Tom Swarbrick here on LBC. It's 12:33. News headlines now. Tim Humphrey.
The Prime Minister says classrooms are safe and children at most primary schools in England should go back this week. Some teaching unions are calling on Boris Johnson to do the same as in London and close all primaries across the country following a rise in coronavirus cases. There are calls from council leaders in Liverpool for another national lockdown to try to stop the spread of coronavirus. COVID-19 cases in the area have almost trebled in the past 2 weeks. The head of the London Ambulance Service has told LBC their crews are the busiest they've ever seen. NHS services in the capital and the southeast of England have been struggling to cope with the rising number of coronavirus infections. The weather, England, Wales and eastern Scotland will be rather cloudy with showers on the east coast, dry with some sunshine elsewhere and a high of 5.
This is LBC. Swarbrick on Sunday with Tom Swarbrick on LBC. Text 84850.
Poor Mo. I mean, of course, anybody who has had that first dose, who was expecting to have the second jab over the course of the next few weeks, who has now seen that pushed back, you're in our thoughts because it's, you were so close to getting that full immunity. Although it is worth repeating again, as the professor did, that once the first one has been taken, you are building immunity. But, of course, you need to be a bit careful about how you go around the place. Having said that, Jonathan Van Tam, the Deputy Chief Medical Officer, is in the papers today saying many more people will have greater degree of protection because of this change of strategy of using the second dose that would be going to people like Mo and actually using it as the first dose for many other people. Pete's in Stafford this afternoon. Hi there, Pete.
Hi.
I think you might be in a similar boat. You've had one dose, have you, sir?
Yeah, I've had one dose. Had it 2 weeks ago at the County Showground. And I must say it was just like clockwork. It was great. But I don't trust anything that this government or its medical advisors say. They're now saying that I've got to wait 3 months. I haven't heard anything from my doctor or from anyone else to confirm or deny that. What worries me is 3 months' time, this seems to be governed by supply and demand. What guarantees can they give me that in 3 months' time I'll get the vaccine? Or maybe they haven't got enough, and so they'll conjure up another excuse as to why it could be delayed again. I have no trust at all.
I understand that. And managing expectations around dates is a very difficult thing that the government has struggled with throughout all of this. Sometimes understandably, sometimes it's been their own mistake. But is there a possibility of being reassured at the notion that many more people will have greater protection because of the fact that your second dose is being delayed? That maybe we can start to see some of the restrictions come off by the time you get that second dose?
Well, as I say, I don't trust anything they say. I think they'll conjure up any kind of reasons they can to justify whatever they want to do. And we were told. I mean, I'm not a big fan of being vaccinated, and it took me a while to go ahead with this. And this has made me even more cynical about the whole process.
Well, listen, Peter, I understand your cynicism. I was born cynical, so I completely agree with you on the cynicism. But you must get the second jab when the time comes, because it really would be a waste of time if you only got one and then didn't get the next one when the opportunity did eventually come. Thank you for your call. 0345 6060 973 is my number. Many more of your calls to come, but you may be forgiven for having forgotten that we have indeed left the European Union. The deal was signed, the date on the 31st was passed, and so we are now fully out and into an entirely new relationship. David Davis is the former Brexit Secretary. He was is the former chair of the Conservative Party and Conservative MP currently for Holton Price and Howden. Thank you very much for joining us again on the programme this afternoon, Mr. Davis. You voted for the deal, or at least your colleagues and you voted for the deal in that sitting of Parliament. Do you think it's any good?
Yeah, I think the deal itself, on balance, is pretty good. I mean, the trouble is, it's 1,200 pages long, and I have to tell you, I haven't yet read all of it. That's it takes a long time to go through a legal document like that. So yes, Boris has broadly maintained our control of things, or acquired our control of our laws and our money and so on. But there will be details in it which worry me. And which we'll have to pay attention to in the coming years.
Do you think that if something pops out of the woodwork in your eventual reading of it that makes you think, oh, that's really a lot worse than I thought it would be, would you regret your decision to vote for it?
No, I think most of the things that might pop out, as you term it, will be things we can do something about. I mean, let me give you an example. I am a bit concerned about the fact that in 5.5 years, when we take back control of our fisheries in toto, that the Europeans have allowed themselves the right to cancel some of the trade deal. Now, that will put enormous pressure on us not to correct the balance of who does the fishing in our waters to our own interest. So things like that you can deal with, the way we did. I'm not going to highlight on air how we do it, but there are diplomatic and other methods and policy methods you can do. But the trouble is, you've got to start now. You can't wake up in 5 years' time and say, "Oh dear, we're going to be blackmailed out of our own freedoms."
So we've got these sort of moments in the future where there are going to be decisions to be made that have perhaps been pushed into the future to make them then. But coming back to the present, what is it that you think the government should do now? And I know you're a big advocate for things like free ports when you were Brexit Secretary. What changes can the government do now to start to take advantage of some of the freedoms that we've now apparently got?
Well, I mean, some of the things we can do. I mean, most of the things which are sort of steady state, the regulations for the car industry or the chemical industry or the oil industry, they're not going to change very much. Because actually it doesn't suit those industries from to change. But new industries, artificial intelligence, genetics, some of the biomedical industries, we can actually do things about improving the regulations. I mean, you saw a little bit of it with the clearance of the vaccine. that took place much more quickly here than it did on the continent, because the continent has a much more cumbersome system. We had control of our affairs. We could do it quickly. We should do that systematically across the whole of medical drug approvals. It takes too long, particularly for things that are dealing with life-threatening conditions. So there's that. The whole artificial intelligence industry, we are going to be a world leader. We can set up the regulations actually to do the right thing.
And we couldn't do that inside the EU, could we? No, we couldn't do that with the, I know it wasn't a trade deal, but the withdrawal agreement that Theresa May put together.
No, well, I resigned over the withdrawal agreement that Theresa May put together. You might, precisely because that actually handicapped us unnecessarily. But no, we couldn't do that. I mean, we've just had the elimination of VAT on sanitary products. We will be able to, whether we choose to or not at the moment, we'll be able to, for example, do away with the VAT on energy, to deal with energy poverty. I mean, there are things like that we can do now that we could not do before.
Let me ask you then a quick political question before I ask you about the coronavirus. There's a poll out today that suggests that were there to be an election tomorrow, Keir Starmer would have the largest party, that the Conservatives' majority would be wiped out. Is there a problem now that Brexit has been seen to be done, that there is no reason for some of those people who voted for the Conservative Party for the first time in 2019 to vote for them again, because the chief issue of Brexit has been to an extent resolved?
Well, I wouldn't say it's a problem. There's a challenge. There's no doubt about that. And bear in mind, when I first came into Parliament, it was under Margaret Thatcher's leadership, and just about every week for the 4 years between elections, we would have lost. And until we actually got to the point of election, she was very clever at actually organising it so that when the election was called, we'd recovered our popularity. And it's typical in Britain that governments are unpopular. During
Do you think Boris Johnson can recover his popularity sufficiently
I think he can, but he's got to remember, his big champion, the man he idolises is Winston Churchill, and. You always got to remember that when Churchill had effectively won the Second World War, the British people threw him out and said, we'll have somebody else now, because he'd fixed the problem he'd been elected or put in place to solve, as it were. And there is an element of that about this. Now we've delivered Brexit, well, people may say, well, OK, we can go back to our traditional voting patterns. And what that means is that Boris absolutely has to set his mind to an inspiring new set of policies. Now, when we get the vaccines out to, and you've been talking about that, I know, out to more than half the population, and herd immunity starts to come in, and we know that we're not going to have another lockdown, economic confidence will start to recover quite quickly, I think. At that point, he's got to use the rebound to build a new image of Britain. We're beginning to hear the sorts of sound bites coming out. Gove keeps talking about a science superpower. We have everything in this country to make us a science superpower, but the government isn't doing it yet. We have to do things in terms of addressing social mobility and the so-called level up agenda.
That's it. I think
not talk about it.
It's the levelling up, isn't it, that is going to potentially win back those hearts and minds that may well have been lost. Very, very finally, and I'm afraid we're going to have to be quick on this, but I know it's something that you've talked about a lot before. Vitamin D. Tell us about vitamin D.
Well, I can't understand why the government isn't actually issuing vitamin D free in large quantities to everybody in care homes. They're beginning to do it next month, but everybody in care homes, everybody in the black and ethnic minority communities, everybody with diabetes, because vitamin D, clearly it's now understood by modern medical science that actually it enhances or facilitates your immune system, not just to COVID, but to all of the respiratory diseases. And one of the reasons, COVID is obviously a seasonal disease. It's going to keep getting worse probably to about March. Why is that? Because our immune systems are weak in the winter. We can fix a large part of it, not all of it, but we can fix about half of it by giving vitamin D. Why the government doesn't do it, I really don't know.
I'm sure you'll keep the pressure up. David Davis, thank you very much indeed for your time. You're the former Brexit Secretary, former Chairman of the Conservative Party, Conservative MP for Holton Price and Howden. It's sort of weird, in all the discussion about coronavirus, you kind of forget that Brexit ever really happened, to be honest with you. Come back to more of your calls about the vaccine in just a few moments' time as well. Tom Swarbrick here, 12:47.
Coming up at 1 on LBC, Chris Bryant.
So the big question, vaccination. Are we getting this right? Or will this be as big a debacle as PPE and test and trace?
Chris Bryant on LBC. Swarbrick on Sunday with Tom Swarbrick, live from Westminster on LBC.
Here's Brian in Basildon. Hi there, Brian.
Oh, hello there. Just making the point that this is to cancel now. The arrangements have been made. The latest arrangements for the over 80s. It's going to cause chaos. I'm over 80. I've just had the first jab. A lot of the people in the queue for the jab obviously have not got computers. They probably haven't got mobile phones. It's going to take as long to sort of get it sort of cancelled as it is to actually administer the jab. And I think it's just people are going to turn up for their appointments not knowing they've been cancelled. If they are cancelled, I just see complete chaos because of this.
But do you think? I appreciate the sort of chaotic way in which it may have been done. But do you think ultimately the right decision has been arrived at?
No, I think they should. If they've made an arrangement to give you the second jab, the first one I believe gives you 83%, something like that. Slightly worrying. I'm not quite sure what that means. But, if they made arrangements to jab the over 80s that they've arranged to jab and then sort of go on to the next stage, but to sort of leave people up in the air, and I've had no notification yet, and I'm supposed to be having it on next Saturday. There are people who are going to have it tomorrow, as far as I know, from my surgery. Whether they've been contacted or not, I don't know. I mean, you don't know if you shouldn't go or if you're waiting to see if your own doctor is making a sort of decision that he's going to get the second jab. It's chaos. It's really bad. I think you just go ahead with the arrangements you've made and then start after that with the jab, because that will be the next group of 75 to 80s who are less.
Well, they need to get. I would suggest that they need to get as many of these new Oxford AstraZeneca vials into the country as possible, in order maybe to fulfil the commitment that they made to people like you, Brian, that you were going to get your second dose when they said you were. I understand your frustration. Thank you very much indeed for your call. 12:51 is the time. If you picked up a copy of the Sunday People this morning, you will have seen what is an absolutely horrifying tale of Anabel Sharma and her mum Maria, who were both in hospital with coronavirus at the same time. Very, very sadly, Anabel's mother Maria died 24 hours after a picture was taken of the two of them on oxygen, holding hands in separate hospital beds. I'm very pleased to say that Anabel Sharma joins me live on the programme. Thank you so much for joining us, Anabel. I'm so sorry for your loss. Tell us how it all happened to you and your family, and to you and your mum.
So we all started getting ill in around October. It was my middle son who first had symptoms. We had the test and he tested positive, so we all began to self-isolate. But over that 2-week period, the children sort of bounced back quite quickly. My husband was in bed for a couple of weeks. My mum started getting ill. I was the main carer for about 2 weeks, but it got to the point where I was really struggling to breathe myself. I'd be collapsing quite frequently. I know now due to lack of oxygen. And that's when we were advised by 111 to call for an ambulance, and we were both taken to intensive care.
And you and your mum were in intensive care for how long?
So I was in for 5 weeks. My mum was there for just over a week before she passed away.
And there is this picture of you two holding hands on the front page of the paper. I just can't imagine what it must be like to not only go through it yourself with such a severe illness, but also be so close to your mother and see her die as well.
So they basically, because I was so poorly myself, a lot of this was happening and I wasn't aware, but I was told that the medics had spoken to my mum and said to her that she was very ill, and even if they were to ventilate her, put her into an induced coma to ventilate her, that her chances of survival would be less than 20%. And they wouldn't know they couldn't sort of guarantee what her quality of life would be like afterwards. So my mum signed a do not resuscitate agreement, and that photograph was when they brought her to where I was in my bay for them to tell me that she probably only had about 24 hours or so left to live. So I asked them to take a photograph because that was the last one that I was going to have of her.
I just can't imagine having to make a decision like that.
The treatment for COVID is really horrific, and I really struggled with it. It's very the hood is like sticking your head out of a car window when it's going at like 30 miles an hour. So this is really forcing the oxygen into your lungs. So it's really sort of hard to learn to breathe with the hood. It's claustrophobic and you have to keep it on all the time. So I was quite sedated a lot of the time due to the fact that I was really struggling to tolerate it. So in a way, I can understand why Mum made her decision that if they were to stop treatment, that's what it was going to be. She told me that she'd had enough of the treatment.
And I just going through all of that, not just the invasiveness of the treatment, but for your mum as well. As a family, I wonder what you make of these pictures that we see sometimes of the people who are out having the parties, or the police were talking about breaking up hundreds of parties on New Year's Eve. When you have lived through this and gone through such an utterly horrific experience,
it just makes me very sad. But I'm not here to judge anybody. The reason that I sort of spoke out was because I just wanted people. Initially, it just started with a Facebook post with my own friends and family, just to say, just be careful because this is what can happen, and I would hate for it to happen to anybody else.
And it is worth saying as well, and I hope you don't mind if I mention your age, but you're young, and you are on oxygen as we speak right now.
Yes, I'm 49. I need oxygen all the time. I get breathless just making the bed. Prior to COVID, I was a very keen kickboxer, and I would train for about 6-7 hours a week. And I was fit and active. And yes, as I said, making the bed now leaves me breathless.
Once again, I'm so sorry for your loss, and I'm so sorry that it has been an absolutely horrendous period for you. I can't imagine how difficult Christmas must have been, given everything that you've been through. What do your doctors tell you about the chances of coming off the oxygen and the recovery that you might have?
So they don't know because the virus is still so new. Even some of the treatments or what they were doing to me in hospital was all sort of things that they were picking up from other colleagues. So it was all sort of trial and error. At the moment, they don't know what the long-term effects will be. I know I have permanent lung damage. Whether I'm going to be on oxygen for long term is unknown, and my life expectancy is also unknown at this stage.
And I wonder if you think, based on all of that, whether we really should be locking down very hard again now.
Again, I'm not here to sort of people are at different stages in their lives, and everyone is different. If Isaac hadn't gone to school, would Mum still be here? There's a chance that he might have been, but I don't know. But at least for people to exercise caution if they are going out or they feel the need to go out. Like I said, it is affecting different people in different ways, but just be sensible and be safe. That's all I would ask.
Once again, Anabel, I'm so sorry that this has happened to you. I'm so sorry for the horror that you and your family have suffered. Thank you so much for coming on the programme. It's Anabel Sharma, whose story you can read more about on the Humans of COVID-19 Facebook page. Anabel Sharma, who contracted coronavirus alongside her mother, Maria, who very sadly passed away in hospital. There's a picture on the front page of the Sunday People this morning of them holding hands for the final time, a reminder that this thing is still incredibly dangerous. Thank you very much indeed for all your calls, text, tweets. We're back. I'm back on Monday, tomorrow at 10 p.m. If you missed anything, there's the LBC app. Ian Payne with you at 4. Right now on LBC, the Right Honourable Chris Bryant.
If only I were right honourable. But Tom, thanks very much. At 3 o'clock, we're going to be talking about how optimistic are you about the future of the UK. At 2, we'll be talking about, isn't it time England bowed to the inevitable and followed the example of Wales on closing schools? But first of all, vaccination.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 1 o'clock, Boris Johnson says parents in England should send primary school-aged children back this week in areas where classrooms stay open. That doesn't include London, after the government announced primaries there would stay shut this week. Richard Sheriff is president of the Association of School and College Leaders. He's told Swarbrick on Sunday on LBC he thinks all schools in England should stay shut for the next fortnight.
We think governments should now call for schools to remain closed for the first 2 weeks, for these next 2 weeks, to look at the evidence, look at what's happening. If testing is the right way forward, to get that in place properly, but not rushing to some kind of disaster after the first 2 weeks. We should take our time to think about this carefully and do it in a moderate and sensible way.
The NHS is set to ramp up its COVID-19 immunisation programme with hundreds of new vaccination sites expected to be up and running this week. 530,000 doses of the Oxford AstraZeneca jab will be available in the UK from tomorrow. GP-led services are due to receive supplies in the coming days. Hospitals and ambulance services in London and the South East say they're coming under increased pressure as the number of COVID cases rise. More than 50,000 new infections have been reported across the UK on each of the past 5 days. Nikki Credlin is chair of the British Association of Critical Care Nurses and senior lecturer at the University of Hull. She told Swarbrick on Sunday on LBC that intensive care units across the UK are in danger of becoming overwhelmed.
We're seeing huge rises in ICU admissions and hospital admissions. And those rises are not only great in terms of number, but are presenting a problem because of how quickly they're happening. So they're not giving us chance to be able to get prepared.